chair of the board. Let's get started with the roll call.
And just a quick check from board members. Can you still hear us okay?
We can.
It was
Quiet.
Yeah,
Okay.
very quiet.
Okay. All right, Helen Belanca. Chun-Wei Chi.
Here.
Debbie Diaz. Amy Fellows. Michelle Glass.
Here.
Bruce Goldberg.
Here.
Judy Richardson.
Present.
Cheryl Ramirez. And Mary Lou Henrik. I know Mary is still driving. I can see she's online, so she'll be with us in a moment.
Great. So at agenda review, we're going to be introducing a couple of new folks today, officially at our meeting. We will have our ED report. We have a new pause policy that we're going to be reviewing. We're going to go over our committee reports, including a couple of straw proposals today. And then we're going to review the budget and have a conversation about our strategic direction. So I'd like to start off today with the very exciting news that we have hired our new executive director. Just as a recap for the public, the board delegated hiring authority to a hiring committee comprised of me and Bruce and Judy. We reviewed 45 applications of people who met the minimum qualifications. We conducted 5 first-round interviews and selected 3 candidates to progress to a second interview with the full board. This board held a special meeting 2 weeks ago for those second-round interviews, and together we chose Dr. Miriam McDonald to be our new executive director. We're really thrilled that she's able to join us for a few minutes here this morning. We are all on a first name basis on this board, and Dr. McDonald prefers to go by Mimi. So Mimi is a physician who is currently serving as the medical director for Medicaid and Medicare for Pacific Source Health Plans. She spent 10 years in the public health department in Central Oregon, and as health officer led the COVID-19 pandemic response in Wasco, Sherman, and Gilliam counties. She has lived in the Dalles for many years. She also serves as vice chair of the Health Evidence Review Commission Evidence-Based Guidelines Subcommittee and was a clinical innovation fellow through OHA's Transformation Center. Those who have worked with her raved about her leadership, her competence, and her collegiality. We're really excited to welcome her as our new executive director. Welcome, Mimi, if you want to come on camera and say hello.
Yes, thank you so much. Good morning. I'm just would like to express my gratitude for the opportunity to serve as the executive director of the Universal Health Plan Governance Board. I'm excited and humbled just to continue the incredible work of ensuring equitable access to healthcare for all Oregonians. So thank you so much.
Great. So happy to have you, and we look forward to seeing you at our next meeting. Thanks. I want to extend the board's sincere gratitude to the staff of DCBS, particularly Director Sean O'Day and Courtney Domini from the talent acquisition team. They were immensely helpful through the whole process, and we really appreciate their support. Also today, we are formally introducing our newest board member, Mary Lou Henrik, and looks like she is going to be joining us later. So maybe when she gets here, I'll give her a few minutes to introduce herself and say hi formally. She did join us for our last special board meeting 2 weeks ago, but we'll give her a few minutes when she gets here today. And great. Judy, can I hand it over to you for public comment?
Thank you, Chair Blanca. Yes, we had 2 written public comments. Can you hear me okay?
Yes.
Great. We had 2 written public comments for this meeting. Tom Sinsick wrote asking us to request necessary funding to support our work. I know that we'll hear a budget update today speaking to that. The second public comment was Kimberly Callahan, who was writing about the expediency of our work and in support of the work that we're doing. So thank you both for your public comments. We do appreciate them, and the full comments are included in the public records.
Thanks, Judy. Okay, we need to approve the minutes from our February board meeting. Is there a motion to approve the minutes? Any second? Debbie seconds. Any discussion? Great, let's do a roll call vote.
I'm sitting here because the audio is going in through my computer.
Oh.
So that's how everyone's going to hear us. So Hello.
Okay.
Okay. Helen Malonka,
Yes.
Chunwei Chi,
Yes.
Debbie Diaz,
Yeah.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Bruce Goldberg,
Yeah.
Judy Richardson,
Yes.
Cheryl Ramirez,
Yeah.
and Mary Lou Henrik.
Yes.
Thank you.
Hey, welcome, Mary Lou. Traffic accident on 205. I know, we all have the same experience. Great. So now that Mary Lou is here, I just wanted to formally introduce her. Mary Lou Henrich started her career as a nurse and has held many leadership roles in public health and healthcare for the past few decades, including as the founding director, executive director of Care Oregon, and also as the executive director of the Oregon Public Health Institute, where I was lucky enough to work for her 20 years ago. She has long been an advocate for a saner healthcare system and for public health supports all our communities deserve. And we're so happy to have her join the board. Mary Lou, welcome so much to.
Thank you very much. I'm sorry.
No, you're
First
fine.
meeting.
It's totally fine.
And then just a quick little tech check. Whenever, if you have any comments or you're going to share, there's a little microphone there in front of you. There's a little button to press that'll make the light go green, and then you'll be able to speak and everyone online can hear you. Perfect.
Great. Okay, I think we can progress to the executive director report.
Thank you, Helen. So I am happy to announce that we have brought on Echo Northwest, as we mentioned last month. We signed a contract with them. They were able to attend the finance and revenue meeting. They were able to attend the finance and revenue meetings that the committee held on Tuesday. We were able to have a brief introductory call with them, but we will have a formal kickoff call with them when Mimi comes on board so that she can be part of that initial conversation. So Echo Northwest is contracted to support the Finance and Revenue Committee with ongoing taxation and revenue policy support, strategies for new revenue modeling, and financial analysis of the impact of revenue options on large and small businesses and households, and incorporate feedback to refine that modeling after that initial plan has gone out for some community feedback. Also, this week on Tuesday, the protest period ended for the UHP services contract. That contract has been awarded to Milliman Consultants. They will be helping with tasks and deliverables outlined in the committee work plans by providing research, analysis, and policy expertise to all committees except community engagement and communications, but that does include the transitions committee. So the contract includes health policy research and support for plan design, economic analysis, actuarial analysis, and financial assessment of the overall project costs for finance and revenue. They will also help with research and policy analysis to identify the administrative structures and systems needed to administer and oversee the Universal Health Plan for the Operations Committee, and the timeline and steps for transition to the UHP for the Transitions Committee. So the contracting period for them will also be when Mimi comes on board on April 7th, so she can be part of that contract negotiation and bringing them on board. I also have updates on staff transitions. I will be moving on from the board. I've accepted a new position in a leadership role, and my last day with the board will be tomorrow. We will continue to have on the board Kim Yee as the senior policy analyst. Kim has an outstanding background in health policy, economics, and contracting that I think will hugely benefit the board. And Kim will be staying with us through June 30th at least, and at that time the board can make a decision about how to move on with the senior policy analyst position. I also can announce that Katie DeLuca, our board, has accepted a new position, and her last day with the board will be April 11th. I know Katie wanted to say a few words.
Yes, I do. I just want everyone to know it has been such an honor to do this work and work with you on this endeavor. And I believe in each of you and what you're doing beyond belief. And I know that it was a really hard decision for me to make to walk away, but it's the best thing for my family because it's an incredible opportunity with the Attorney General's office. But I just want to, I'm someone that has been in every meeting and every room over this crazy last year that we've had. And you guys are you're getting there, you're onto it. And I think this is a beautiful transition time to bring Mimi on board, the contractors on board, and they're really, really good things ahead, and I'm excited to follow along. I know Jenny is too, and it's been an honor. So thank you and good luck. Nothing but good luck. Mhm.
To finalize materials, and Katie's position will be posted tomorrow. Mimi will have a big first week. We anticipate having applications and candidates ready for her when she comes on board April 7th. And I want to echo what Katie said. It's funny, I wrote this out beforehand before Katie said anything, but I just want to say it's been a privilege to work with all of you. And I really think that the work of each one of you is leading this toward an actual feasible plan, something that a lot of people don't believe can happen, but I think that the input that you're all giving in the work and the dedication is actually making something that can move ahead to the state. And it really has been an honor to be with you. And that's all I have to executive director.
Well, on behalf of all of us, I want to thank both of you for all of the work you've put in the past year. You've been really tremendous in terms of getting our work launched and keeping us on track and doing all of the day-to-day work that makes this board what it is. So thank you both for all of your commitment and dedication and your time. And we're really grateful for what you've shared with us. And we wish you all the best in your future endeavors. We have a couple of quick sort of business points then that we should do at this point in light of those announcements. First, so in the executive director role, we do, of course, have Mimi coming on. She's starting April 7th, but there will be a period of about 2.5, 3 weeks between when Jenny leaves and Mimi starts. We don't anticipate that we're going to be signing any contracts. The contracts have all been signed. Things like day-to-day things like payroll have been managed, but there may arise an opportunity where the board needs to make a decision. And because of that, we should have somebody appointed in that role just as a stopgap measure. And Katie has very agreeably been willing to step in as interim executive director until Mimi arrives on April 7th. So we need a motion to appoint Katie as our interim executive director, which would begin, I guess, Saturday, Monday, Saturday,
Yeah.
Saturday, starting Saturday until Mimi arrives on April 7th. Do I have a motion to that effect?
I move that in the period between Jennifer Donovan's departure on March 21st, 2025, and Meredith Doppel's start date on April 7th, 2025, Katie DeLuca be delegated the authority of the executive director to make executive decisions as necessary.
Is there a second? Second. Great. Any discussion?
Until April 11th?
Yes.
Mhm.
Okay, great. Then let's do a roll call vote.
Okay, Helen Blanca,
Yes.
Chenwei Chi,
Yes.
Debbie Diaz, Amy Fellows,
Yes.
Michelle Glass,
Yes.
Bruce Goldberg,
Yeah.
Judy Richardson,
Yes.
Cheryl Ramirez,
Yes.
and Mary Lou Henrik.
Yes.
Great. One more quick point of business. Mary Lou has graciously agreed to be part of our Finance and Revenue Committee. So we need an official motion to appoint Mary Lou to the Finance and Revenue Committee.
I'll move.
Cheryl seconds it. Any discussion? Okay, let's do a roll call vote.
Helen Blanca,
Yes.
Chenwei Chi,
Yes.
Debbie Diaz, Amy Fellows,
Yes.
Michelle Glass,
Yes.
Bruce Goldberg,
Yeah.
Judy Richardson,
Yes.
Cheryl Ramirez,
Yeah.
and Mary Lou.
Excellent. Any comments, questions before we move on? We're going to have some time in our strategic direction portion of this agenda to talk through what these staff changes mean for the board. So I've reserved time later for that. So I know people have a lot of questions and are wondering what that's going to mean for our work going forward. And I've reserved some time in that part of the agenda to talk about it. But any immediate questions for the staff or anything that we need to follow up on with that? Cool. Okay, then I'm going to turn it over to Judy to do an update to our board procedures.
Thank you, Chair Belanca. In your packets, I believe it's 5.1, you will see a document entitled Procedure for Managing Emotionally Heated or Contentious Discussions. I found a similar procedure quite helpful in other board meetings I've participated in when we're talking about topics or issues that we feel particularly passionate about, and healthcare is definitely one of those things. We'll be talking about funding, it's definitely one of those things. And so this procedure is not a policy. It doesn't supplant anything that we've already established as the way that we work together. It simply walks through scenarios where anyone participating in the meeting can ask for a pause. It's very helpful. The first step, I think, is the hardest one, recognizing when an intervention is needed. And so at any moment when someone feels they are not able to speak their voice, or they're feeling that the room is becoming particularly heated, they may call in Robert's Rules a point of order. And it's described there exactly the text you can say if you want to. It helps to read through this and think about a scenario where you might use it before you need it. The second part is about how the meeting leader or the chair, depending on if this is a subcommittee or other group that you're in, may pause the discussion and let everyone a moment to take a deep breath and think about the next steps. And then resuming the conversation once everyone has had that moment for emotional pause to continue the conversation, or the meeting leader may decide to table the topic. Also important in this procedure is a bit of a reflection and a debrief, which can happen during the meeting or after. And then I did also include some expectations for public comment. We haven't had this happen, but I have been in other board meetings where it has, and we can respectfully request the folks who are coming to speak with us and share information to speak with us within the constraints of how we treat each other. And then a statement of supporting productive community dialogue. I hope this procedure is helpful, and I'll turn it back to the chair for next steps.
Okay, great. So what we're looking for is not, we're not voting on this, is not a change to our policy, as Judy said, but just sort of a chance to kind of think about implementing this as sort of a procedure during our meetings, that anyone in the room can call for a point of order to say, you know, we need to step back or take a break, or we need to table this discussion until later, and allow us to act on it. So has everyone had a chance to read through it? If does anyone have questions about the procedure or what we're talking about here?
And I will add my thanks to those of you who have read this and gave me feedback. I appreciate that. I tried to incorporate it. Thank you.
Yeah, go ahead, Amy.
I think a tool like this could be really helpful. I think if it is not in front of us, it won't be used. So if this is something we're going to move forward with, I would like to suggest that it's on a link to it is on the bottom of every board agenda, and that there's laminated copies in front of the table where the chair and vice chair usually sit, and then on either side of, you know, the other kind of arms of the table, so that it's easily accessible for people in the room as a reminder. And then for people virtually, there's a link to it at the bottom of every board agenda. Because otherwise I think we'll just forget about it.
Yeah, that's a good point. And I encourage all the board members, both here at this meeting and then at all of your committee meetings, if it seems that the conversation is getting off track or not being productive, to start practice using it. It doesn't have to be a big deal, just point of order. Let's table this discussion till later, or point of order, I need to step back for a minute from the discussion. And I think if we all start using it when we feel it's necessary, I think that'll help. But yeah, good point, Amy. We'll make it more available. Any other thoughts, comments, questions? Yeah, Michelle.
I just want to thank Judy and all the folks who were involved in developing this policy. I think that it's incredibly important and helpful, and I appreciate having a clear process. It's something that I wish we had had sooner, but I'm really glad that we have it now. And I just really appreciate this thoughtful addition to our procedures that I think will support all of our goals for how we how we do this work in challenging times with a complex topic. So really appreciate it.
Okay, let's do a quick fist of five about the board's commitment to using this. So for Mary Lou or for anyone else, just show of hands of if you're in agreement that we will start using point of order pauses in our meetings when we need to. 4 and 5 mean you're strongly in favor of it. Fist means you're opposed to it. 1, 2, 3 means you're not sure and need more discussion. So do quick fist of five about, are we in agreement that we'll start to use this? We've got online 555, 555 all around the room. Yes, great. Excellent. Thank you. I skipped over the public comment section of the agenda, the live public comment. There was no one signed up for live public comment at the beginning of our meeting. As a reminder, that is a placeholder in case anyone has comment about any votes we're taking during this meeting, and no one has signed up for that today. And so now we are on to committee updates. To start with the Community Engagement and Communications Committee. We can start there.
Thank you, Chair Belenka. Good morning, everybody. Michelle Glass, co-chair with Amy Fellows of Community Engagement and Communications. So a couple of updates on our current or recent work, I should say. At our last meeting in February, we had Patty Wentz, who's a strategic communications consultant with a lot of great experience in healthcare reform, specifically in Oregon and at the national level, come and do kind of a strategic communications in healthcare 101 with the committee, which was extremely useful. The committee was very engaged, found it very helpful, and learned a lot. And we really, after that conversation, we really wanted to keep working with Patty. She clearly understands the work that we're doing and the importance of strategically framing it, doing no harm when we communicate about it, and has a lot of experience with how to do that very sensitive work. And so there is a statement of work that has been developed for Patty to come on board to support the communications work stream of the committee. And we're very excited about that. And that will include things like creating a strategic frame for the board's work, for the board to consider, as well as strategic talking points. How would we talk about this work in a way that supports really good public understanding, as well as solicits the most useful feedback without kind of triggering pre-existing misconceptions about what this work is. And that's really important. So we're very excited about that. And this will directly support the targeted engagement work that Diana Bianco at Artemis Consulting will be doing as well, because strategic framing is really a prerequisite, as you all know, of doing good public engagement. So in addition, this will support board members that have already started doing public speaking engagements as people request. So I know many of you have been doing that work. I really appreciate it. And I hope that this will be very supportive to all of us as we continue that work to make sure that we're speaking in a unified voice in the most effective ways possible. And I will pass it to Amy for the next part of our report out.
Yeah. So our next meeting next Wednesday, March 26th, we've invited a couple of guests who are have been doing grassroots level work for many years in this area. One of them is Michael Leidy, who has over 30 years of experience and has written and spoken on Medicare for All. Michael is currently Medicare for All consultant with the National Union of Healthcare Workers and is president of Healthy California Now, the state's single payer coalition that's working on these efforts in California. And then Rebecca Schoon, who has been part of the Healthcare for All Oregon board since 2022 and holds a PhD in health policy focused on and is an assistant professor, I'm sorry, currently of public health at Pacific University, and she teaches undergrad students studies of comparative health systems, universal health care, and how political, economic, and social inequities impact community health. So we're going to have the two of them come and talk to our community engagement and communications committee, just kind of about grassroots efforts, and just give that perspective for the group as well.
We don't have any questions for the board or other committees at this time, other than just, again, kind of checking in to see if there's any updates on timeline. As we work with our consultants and make sure that the strategic communications framing is ready in time, and also that Diana is coming back to start on questions at the right time. So wanting to check in with the plan design and finance committee chairs to see if June still is the working hypothesis for when we'll have draft plans.
Yeah, go ahead, Joe.
That's going to be kind of tight for finance and revenue since we just now have the consultants on board, but we can certainly strive to have something for you. Communications comes up every single committee meeting. So we're talking about it. We're just not there with our proposals yet. So, but we'll shoot for that. And I do know we need to meet with plan and design in July. That's still kind of on our agenda, on our schedule. So there's that. Make sure we're in sync.
I agree that June seems like kind of a tight timeline. We're just now going to be taking up, I mean, we'll have some, it really depends. We have some draft proposals that we're going to review today, but on the outcome, we're still working through eligibility and haven't taken up provider reimbursement. So it in person, obviously, we're going to need to make some tweaks and adjustments based off costs, which we're not at the point of doing yet. So
thank you both. And this question is really just reflecting back what we've heard in previous meetings and kind of bringing it back every month to make sure that as things shift, we are shifting with you. So this is not to create pressure for an artificial timeline. We certainly want the work to be, we want to pick up the communications work when the plans are ready. So please let us know if we need to ask Diana to come back maybe in May instead of April to start working on the questions for engagement if you think July is more realistic, or if there are other changes. Again, we're just trying to shift with you so our timelines align. And then also I heard the comment, Cheryl, about, talking about communications at every meeting. Certainly as we onboard Patty once, if there are communications needs as you're developing the plan, let us know. We're here to collaborate and support your work in whatever ways we can.
I'll do that. Thanks. And I do think that May would be more realistic for sure for Diana to come back on, because April is when Echo Northwest is actually starting. So that would give us at least a month and at least one meeting.
Thank you for that. That's really helpful. We'll reach out to Diana and update her on the timeline, and that'll give us more time to work with Patty Wentz as well. And again, if things shift again or need to be adjusted, please just let us know, and we'll continue to ask at every meeting when we do our report out so that we can all move together as much as possible in this complex iterative process. So really appreciate that. We also have no straw proposals today, and no resource requests today. So.
Thanks, Michelle and Amy. Yeah, go ahead, Bruce.
Listening to Michelle, I would suggest that we invite Patty Wentz to the board to give her health communications 101. I've worked with Patty for a couple decades now and learned a tremendous amount from her. And it sounds like the presentation was well received by the Community Engagement Committee, and I think would be great background for the board. So I'd encourage us to invite her to the next or some future meeting.
That's a great idea. Yeah.
Yeah, I like that.
Any other comments, questions for community engagement and communications? Okay, moving on to finance and revenue.
Hi, everyone. So this is Cheryl Ramirez. I'm the chair of the Finance and Revenue Committee. We just met this past Tuesday, the 18th. That was our last meeting. We don't have any straw proposals. I'll just cut to the chase there. As Jenny mentioned, we met Echo Northwest. That was really great, and I'm very excited for them to get started. I understand that they will be fully on board in April, and there's going to be a meeting about that, and they're going to go over their scope of work. So, and I believe I'm invited to that meeting. So look forward to understanding more about what their scope of work is, although I do have the contract and I've been reviewing myself. I didn't get to ask this when they were here, but when they were at our meeting. But one of the consultants is based in Seattle. His name's Morgan Shook. And I was going to ask him if he could from time to time give us an update on how Washington is doing with their universal health care plans. I bet he knows. And so I don't know if that can be within his scope of work, but I'd really like an update from him. So I might ask that. We had lots of questions and comments this past Tuesday. Just a few things that just keep surfacing that we haven't quite resolved. One is the kicker issue, and we got an update on that from Jenny that it's the DOJ attorney is handling that question with the Department of Treasury, and we hope to have some at least preliminary response or answer soon. The reserves from existing health plans and providers keep coming up. We know that's part of the transition team or the transition committee, but we're still concerned about it. Chenwei gave us reminded us of the Taiwan example of 1 to 3 months of reserve that we need. And we know the health plans and some of the providers have way more than 1 to 3 months reserve. So there's a question of what happens to that reserve when we begin. We were able to review again Chenwei's tax revenue option presentation that he provided for the board last month, and that was really helpful, just to give us a foundation for our recommendations and further discussion. It generated additional questions and comments. One of which was the fact that we believe we need a worst case scenario in case Medicaid and Medicare are either dismantled or drastically cut by the current administration. So that's on the table. Besides our optimal proposal, we're going to have a worst case scenario proposal. I think that's a great idea. Kimmy also briefly presented on the tax structure considerations that were based on our principles in a white paper that Charlie Swanson wrote. She did a really nice Venn diagram, and I think those slides are available if you want to look at those. That brought up some more questions and comments about Medicare premium differences, corporate activity tax, employer payroll tax, provider assessments, what we do when we don't have those anymore, and employer tax rates for various populations. So just lots of questions, lots of discussion. It was really good feedback. And I think it was really great for Echo Northwest to listen in and experience what we talk about in those committee meetings. And it'll be great when they can answer questions. So we generated a whole list of questions and comments for them already. And I was trying to jot everything down. I know the staff was too. We are working on scheduling a deeper dive on the admin cost. And I saw in the scope of work, this is something that Echo Northwest will help us with, which is great. I'm glad to see that. But we did want to have kind of a panel of potentially retired executives from various providers and health plans to talk to us about administrative costs. I think we've been having a little bit of a hard time getting them all scheduled all at once. So tentatively, we had scheduled this for April 1st. I'm kind of thinking that's not going to work out. It won't be realistic. So it might be April 18th, and then we'll keep digging into the revenue plan. So we always have a pre-meeting, and that will be next week. And I think we'll just have to make a decision on whether we meet on April 1st or not. So that's something we need to figure out next week. And I think that's it for us. I don't have any questions for the board. Oh, please, Chun-Wei.
I just want to supplement what Cheryl just reported. A few issues that just heads up that eventually the board will have to take up. One issue was about the contingency reserve that Cheryl mentioned. The contingency reserve in Taiwan's legislation of universal healthcare, it was put into the law. And an example is the law required, so with 23.5 million, that's a huge population. They require the contingency reserve need to maintain minimum of 1 month's expenditure, total expenditure, 1 month. If it's below 1 month, that's the time to raise the tax. And you need to maintain between 1 month and 3 months. And if it exceeds 3 months, that's the time to reduce the tax. So that's as a reference. Once we decide about the taxation, we need to have that boundary. When should guide us to raise tax? When should guide us to reduce tax? So that's something ahead of us. The board eventually will have to take up. Another issue related to what Cheryl just mentioned about why it matters to have a more accurate estimate of the administrative cost saving, because it matters about our payment. And previously, we I think the task force has the Brand Corporation did estimation, and the finance committee in our previous meeting think that's underestimate the administrative cost saving. So the finance committee, want to have a more accurate estimate. So when we design the payment system, that will be an important factor. How much we pay the provider by subtracting. We want to maintain the current level, but the saving, if we have accurate estimate, we want to reduce that saving because that's the system help the provider save. And finally, another issue, eventually the board may need to decide is in considering taxation, traditionally we follow the current exemption for the small employer. But I mentioned during the meeting, the reason to exempt small employer from having to provide health insurance was they have a small risk pool, make them very difficult and expensive to buy health insurance. But that factor no longer exists under universal healthcare because we are all under the same pool. So that's an issue eventually the board will have to take up, whether we want to exempt small business from the payroll.
Thank you for those additions, Chun-Wei. And welcome, Mary Lou, to the committee. Any questions for us?
Can you remind us what the kicker issue is?
It's so that we can avoid a kicker for the universal health, like that it will have to, that
That
we,
the taxes
that-
paid
yes, and that it doesn't get
kicked back.
kicked back. Yeah.
Well, I think what I just mentioned
Uh-huh.
can supplement the kicker issue. Because if the board decided, similar with Taiwan, again, that's just a reference, 1 month versus 3 months, that if our reserve exceeds certain level, we reduce tax. And that will be our leverage to argue against.
Right, yeah, that's a good point.
Yeah, Bruce.
I think the kicker issue is being dealt with in our design of the plan and having a fund in treasury. Because actually that's what we're talking
Okay.
about right now, is being able to have a fund in treasury separate from
From the general
from the
fund.
general.
Yeah.
So I think that's part of what we will be discussing at the operations committee.
Yeah.
And I don't think we can design it so that it is protected from the kicker.
Okay.
Right, because all revenue.
State funding, for instance, is not subject
Okay.
to
The kicker.
the kicker itself.
Mhm. All right, that's good to know.
Wait, any other questions, comments for finance and revenue? Right, moving on to plan design.
We had our most recent meeting on and we spent the entire time talking about 3 topics. We had a large group discussion on eligibility. Okay, sorry about that. Large group discussion on behavioral health and kind of finalizing a strong proposal for that, as well as long-term services and supports. We have 2 straw proposals to present to you today that we'll get into in just a second. At our next plan meeting, we did not reach a resolution with eligibility. There were still questions and discussion to be had and some more information to be sourced. So we're going to revisit that at our upcoming meeting, as well as start getting into provider reimbursement, which will start with a presentation from OHA, grounding us in our kind of the task force recommendations on provider reimbursement and giving us kind of a place to start from. So I think as far as what we need, really at this point, going over the straw proposals and talking about those is the main thing I'd like to focus on today. As far as our I think kind of ongoing with we're going to need finance estimates, and that's kind of the big elephant in the room at this point. And then once we get to the point of having something to present to the community, engage with the community and community. So the first straw proposal will be 8.1, which I believe is going to be the behavioral health.
I'm going to pull it up too.
Everyone has had a chance to take a look at this, but ultimately, behavioral health coverage in most commercial insurance plans is actually not as robust as what is covered by the Oregon Health Plan. So we would want to change the current benefits that, we're talking about doing benefits modeled after PEB with some enhanced benefits, but as far as behavioral health, that would have fallen short for the majority of folks. So the idea is to expand those benefits and to model it after current covered services and provider types by OHP. And then there's a few additional covered services that will be further down on the list. One of the things that we really want to emphasize is integration with primary care. And that will be really kind of expanding on the model of FQHCs, so federally qualified health centers, that integrate behavioral health into them, as well as CCPHCs, which are certified community behavioral health clinics, that will really kind of be these primary behavioral health centers, but also have wraparound services and help to integrate into primary care. These are the list of covered services, and it's kind of broken down into residential, acute, and intermediate outpatient, case management and navigation, crisis services, preventative services, and then there's some services from mandated programs. Specifically for those mandated programs, which is in the other category, we're just recommending currently billable services. There are services that will still need to come from state general fund and are not considered billable services. And then some of the services that are not currently covered by OHP would be case management and navigation before a full assessment to help with the backlog. So not being able to bill before a full assessment, and there's a backlog on when the full assessment is able to happen. So helping to kind of help with throughput there, and also mobile outreach services. So really emphasizing on meeting where they're at and coming to them and removing barriers as far as them needing to seek services themselves. And then the Oregon Health Plan also does expand coverage for and those that and provider types beyond those commercial plans. So we did want to expand that coverage as well. That's a little further down after scroll through. But ultimately, we'll need support from finance and revenue. Need to have a financing structure, need to know where, you know, what is doable, what this is going to look like, expanding this to folks outside of what is, you know, those that currently qualify for OHP. And then ultimately with community engagement and communications, getting the message out and seeking input. And I do have, I don't know if Peter Addy from our committee was also going to be present today to help answer any questions, since this is a little outside my area of expertise, but that is the overview for the behavioral health straw proposal. And I would just say the hope is that this would be something kind of like an iterative expansion, that this would be kind of like the first step to making things better for as many folks as possible.
Do you want to handle questions? Is that Amy?
I know Amy has a question.
Sure, I'll handle what I can and then see if Peter wants to jump in. Actually, Peter, is there anything you want to add to what I just said? Feel free to jump in.
I think that's a great summary. Thank you. So basically, yeah, we're using OHP as the template instead of PEB, and even within OHP, different CCOs have different levels of coverage. So we just want to take whatever the best or the most comprehensive coverage is from each CCO and just kind of raise every part of the state to those standards.
I'm sorry, is it my turn? You cut out. Okay.
Yes.
Okay. So my question is, will independent mental health providers, you know, still qualify? I get kind of supporting and focusing FQHCs and the certified community behavioral health clinics, but if you look at the independent mental health providers, they often are more people of color and disabled providers that often do not fit into other settings, especially on the community behavioral health side, because of systemic racism and ableism. And, you know, many people depend on seeing independent mental health practitioners, including my family, because of this, to get more culturally appropriate care. So I just want to make sure that there isn't going to be a disincentive for independent providers.
I sure hope so. I am a disabled independent provider, and I wouldn't want to disincentivize myself. So absolutely, I think that, I mean, right now on the screen, we see the license type, so that's certainly covered. And then for the services covered, just like OHP is now, you know, I can bill Care Oregon or Trillium or et cetera. I think the incentivize or disincentivize is a conversation that will continue with the reimbursement, which we will talk about next month.
Can I jump in?
Thank you. That makes me feel better, Peter.
I'll just, this is Helen Blanc. I'll just jump in to clarify too, that it's in our legislation that any licensed provider who's offering services within the scope of the plan will be covered. So it would never be the case that we wouldn't pay for an independent provider. If they are licensed and practicing within their scope and offering services on the plan, they will be paid. So I want to clarify what's in the beginning of this proposal, in that our goal is to provide comprehensive, bidirectional, integrated care, that it should be easy to get behavioral health care, no matter where you are in the system, and that we have models for how that integration looks, but it's not for everybody, right? So our proposal mentions FQHCs, and FQHCs have done a good job of integrating behavioral health. We also have lots of other private practice, primary care, medical home models that integrate behavioral health in really great ways. There's lots of models in the state where that integration looks great and works really well. And then CCBHCs are there for providing more extensive services severely mentally ill folks, and folks who need additional levels of services. But that's sort of an overall model. We just want to make it easier for everyone to access the care at the level that they need. But certainly independent practices, both in primary care and in behavioral health, will of course still exist, and try to make those accessible to everyone.
Yeah, that's great. I just know in the disability community, many people have been harmed in those more integrated settings because of being misunderstood. And that's not in every setting, but I have heard too many stories. So I just want to make sure we continue to have other options.
So I was going to comment on the straw proposal. I certainly agree with the goals of the straw proposal. I would suggest some minor language revisions, and I'm happy to help with that, just to update the types of services and a few other things. So I don't know how I do that, but I would vote in support of the proposal, but I also would like to make some corrections. So not sure how.
You definitely send it to you.
Okay.
And I welcome your update.
Okay, sure. And secondly, and I think Peter and Amy know this, I don't completely agree with unlicensed clinicians being able to practice independently. But we don't need to go deep into that today. I don't think it's that relevant.
No, I'm not speaking to unlicensed.
Okay.
That concern came up before, and if you can scroll down to the next section of the proposal. I know there's a lot of discussion going on at the state level on this issue. And so as a placeholder, we framed it as unlicensed clinicians are still an important part of the system, but they would work with the oversight and partnership of licensed clinicians. This is a conversation that's happening at a much bigger level than the board. Folks should know that staff are in communication with the governor's office and aligning our proposal around behavioral health with the governor's priorities. This is an area where a lot of work is being done on the state level, including this issue of unlicensed providers. And our goal is to remain in alignment with the governor's priorities and still try to honor the intent of that role, which is to increase access to needed behavioral health services. So yeah, we're kind of talking that through.
Yeah, great to have more access. I think that's fantastic. Totally support that. What I just want to be certain of that we pay attention to is that it all sounds great, but right now, if we're modeling after OHP, there are a lot of administrative and bureaucratic barriers to people getting care and to providers providing care. There's a huge administrative burden to a lot of providers that keeps actually providers from billing Medicaid. And I just want to be certain that we don't have the same two-tier system as we do with OHP, where we have a very different bureaucratic structure to pay for mental health and behavioral health claims, and very different on the physical health claims. And we need to have one. It needs to be easy, and the words are great, but I can assure you that today in OHP, some of the things we cover don't get paid for because providers can't comply with many of the bureaucratic requirements. I think it's a hugely important issue. I just think we need to pay attention to that.
Totally. We still aren't at parity.
Exactly.
So in many ways, I wonder if you're suggesting that that the board add to the straw proposal, that it would include some administrative simplification. And my understanding is it's about, go ahead.
Administrative simplification commensurate with what's happening elsewhere in the healthcare system.
Right.
Yeah.
Physical health.
Not just making it a little bit better.
Right.
Yeah.
Commensurate with what's happening physical health. And so my understanding is we're talking about data collection and reporting requirements. And billing, everything.
Assessment. Being able to serve people right away.
24/7.
Like, so many things.
Okay. Yeah.
I was following Bruce here. My question is just maybe a simple one. Well, back up at the top, when you talk about adult foster home, foster whatever. I'm trying to understand, it's way up at the very top.
It's right there, yeah.
Okay,
List of
great.
covered services, yeah.
Adult foster services. So I'm just a little confused about exactly what I know what adult foster care is, but in terms of behavioral health. I don't know.
So, I think in this context, it's a type of residential treatment. So they're called adult foster homes. And so it's a home where a very small group of people live, and they need case management, they need help, they may need a guardianship, and they live in a very small group.
Okay, there's 685 of them in Multnomah County, for example.
Yeah.
And they're mostly elderly people.
Yeah.
Who, better for them than having in-home. So, but I guess I'm just wondering where in the behavior, not everybody there, or, I mean, I guess I'm just confused about, there's a monthly rate. My father-in-law lived in one, and you pay that, and so it's kind of like, I'm just having trouble understanding if that gets diced out, or if that's, we pay for the monthly rate of these people living there totally, or.
Yeah, I'm not sure what, that's not detailed here,
Okay,
but that's a good question. I
At
don't
some
know.
point, if we're gonna include, I'd like to know, especially on the finance and revenue.
Yeah.
What are the
Because
boundaries?
it would be the same for secure residential treatment facilities, residential treatment facilities, residential treatment homes. We'd have to figure out how we pay for that, right? Exactly.
We have a 1915 I would believe. It's
For the
for people
services.
with severe persistent mental illness to get those sorts of services. That's about the level of my understanding.
And then there's Medicaid. I mean, just straight Medicaid, billing codes too, as well. Right.
All right, so some folks need adult foster care because of just needing help with their activities of daily living, bathing and dressing, right? But we're talking about adult foster care homes for people whose mental illness prohibits them from living independently.
I see.
So it's a subset. It's a subset of adult foster homes.
Yeah. That was my.
Yeah.
Yeah. So it's not the intellectual and developmental disability group foster homes. That's right.
I understand that, yes.
Yeah.
But it allows them to qualify based on severe illness, not simply on the same sort of a senior and a senior.
Yeah, okay.
Yes, a related issue with adult foster home care that eventually the committee, but also the board will need to decide is what we define as long-term care. Because the long-term care is arbitrarily defined. Under Medicare, any continuous stay in the residential care for more than 90 days, beyond that is long-term care. But within 90 days is not long-term care. So eventually we will need to come to define that. What constitutes a long-term care under the Universal Health Plan. But also just a quick comment on the adult foster home. It's an Oregon invention. People who study long-term care praise it because Oregon invented that notion in the late 1980s. And when I was still graduate school, and we learned about this marvelous Oregon invention as an alternative long-term care institutions.
I think it was Dick Black. I was around then.
So again, I'm hearing that the board is considering adding to the straw proposal a dependency on the long-term services and supports. So we need to define what that is and the scope of that, and that will have an influence on this straw proposal too, right?
Yeah, I've always assumed, to Chunwei's point, that since we're setting up a plan where individuals on Medicare and Medicaid wouldn't lose benefits, that we would have a long-term care benefit that was similar to what is the Medicare definition, which isn't continuous, but is a set number of days.
Right.
But
Yeah.
I don't know if you've talked about that in the,
That's our next drop. Yes.
okay.
Amy has a comment.
Oh,
Amy?
I'll hold my comment until you introduce the long-term support and services, because that's where my comment comes in and kind of gets to Bruce's point.
Yeah, but it is a good point that there is some overlap between these two bodies of work, and we need to consider that. Yes.
So is someone, okay, sorry, go ahead.
Before you, Amy?
Oh, I
And-
wasn't sure if you're going to introduce the long-term care or if we're still on this mental health one. I'll wait.
Last call for any comments on the behavioral health straw proposal. Okay, and so the board's official position on this straw proposals, we'll send it back to the committee with those two additions to add information about how they're going to simplify administrative processes and then dependencies on the definition of long-term supports and services. Good.
And language changes.
And language revisions from Cheryl. That's right. Thank you. Okay, good. Okay. You want me to do the long-term? Okay. All right. So the second straw proposal that came out of this committee is the long-term services and supports. This is a really tough discussion. We had a lot of conversation about this topic. And in our high-level summary, we talked about the idea that currently the way the system works is that long-term services and supports are available on a limited basis, as Bruce just mentioned, through Medicare. They're available if you meet qualifications both for eligibility and clinical status on Medicaid. And then they are available if you have long-term care insurance. The long-term care insurance folks that have that insurance is incredibly small. Estimates are somewhere between 2 and 5% of adults have that insurance. About 50% of our long-term care is paid for by Medicaid. And so those are the systems that are currently in place. The committee is proposing an additional mechanism to access coverage through the Universal Health Plan, whereby individuals might participate in a cost-sharing arrangement for long-term care services. We would investigate ideas such as some sort of revenue stream that would fund a public option, something where there would be partial billing for long-term care services and partial coverage by Medicaid so that people wouldn't need to spend down their assets to qualify for Medicaid. But there's this population in the middle, folks that don't have private long-term care insurance and wouldn't be covered by Medicaid. And we need to investigate how that would happen. Obviously, there's a lot of complicating factors there, a lot of research that needs to be done. None of us were experts in this topic. And so what the committee is recommending is that we establish a specific task force to study the option of a cost sharing arrangement or some sort of coverage option for the rest of the population and work with the board's consultants to develop a proposal. The committee felt we talked about the idea of just recommending to the legislature that the legislature set up a task force, but the committee felt pretty strongly that that task force remain under the provisions of this board and still be part of this board's work. So I bring that to you for consideration.
Amy.
Yeah, I guess I need better understanding of where not looking at the elder population, but looking at the disabled population of all ages who currently under the currently ODDS, Developmental Disability Services, has 33,000 people under their services that are eligible for Oregon Health Plan and also receive long-term care services in the form of personal support workers or direct service professionals. And it is not based on income because under the K plan, it allows to get Medicaid funding, not based on federal poverty level if you are disabled. So this is 22,900 adults and over 10,000 children. And I want to understand where they fall in this as we have federal cuts to Medicaid And having in-home supports and access to Oregon Health Plan keeps them from being institutionalized, including my own child. So it's really important to me to understand that this large group of people do not get lost because they are the most vulnerable people in our state.
Right. You're highlighting one of the populations that we talked about. There are a number of folks who are getting services through various means, and this is not something that any of us on the committee have expertise in. We need to understand the current system and the current levels of agency involvement, and we need expertise on sort of sorting out how people currently get coverage. What are the gaps? Who's not getting coverage? Who needs coverage? And what, is there a way that we could make long-term services and supports available to anyone who needs them for any reason within the current structure? It looks like, as we look at it now, that we are required to maintain the current structure through the Medicaid eligibility process. We're not going to be able to change that, and so that will still exist. So we're just talking about the folks, anybody else that doesn't have private long-term care insurance and doesn't qualify for Medicaid, whatever their qualifications are, that group in the middle. But yes, it's going to take some deep diving into what the current system is and how the agencies interact with each other, and how we could, again, simplify the administrative process, because there's a lot of shifting back and forth.
I would love to be part of those conversations, and I can put you in touch with people at ODDS and other folks that have the data and are experts in that area.
Right. Thank you. So the question for the board, though, is that this is not a task that this committee can take on. We need a separate task force. So are you volunteering to be on that task force?
Yes, I would love to be on that task force because it is too dangerous to not have the right lens on that task force.
Yeah. And then we don't have to discuss it now, but what the discussion we need to get to is how would we establish that task force? How would we go about that as a board? If we want to, if we agree, if this board agrees that that work needs to stay within this board's purview, how would we go about setting that up? Go ahead, Marilyn.
I guess my question, and it may be that since I'm so new, but what's the difference between the 4 committees that the board has established and then a task force? Is it not just another committee, or is there a differentiation between committee and task force?
Context, it would be sort of a
sub of your
breakaway of the plan design. It's because long-term services and supports are part of the deliverables for plan design, but we need to kind of find some expertise and some consultants to,
So why don't we call it a subcommittee?
a subcommittee. Okay, yes, right. Okay, good. Subcommittee, yeah. With different membership folks who want to commit to that, yeah. Sure.
That was my related comment. I think a task force has a certain meaning. And so I think subcommittee is more accurate. So I agree.
Question on subcommittee. Does subcommittee mean, though, that it needs to be comprised of members of the committee, or it can be outside as well? I think the point is we don't have the expertise within the committee.
Yeah, I don't know about that, but my experience with a task force is then you're getting into a governor's office created task force and all of the applications, and I don't think that's what we want. But I think that's worth looking into to see if we can recruit other people to be on that subcommittee. I don't see why not, but we probably need to find out.
Michelle.
Thank you. I was just going to reflect back to the board that we have in the past when we had a short-term project that we needed a subgroup of the board members and perhaps outside expertise to help with. We did create work groups. It's a process we've already used and established. It's on our website. And I wonder if this is not, I had the same question as Deborah did about whether a subcommittee implied a subset of that committee, which I think has some tricky implications. So work group is another option that is already in our processes in case it's helpful.
Regardless of what we call it. We need a group of people with some expertise.
Yeah, we need one
to help.
Yes.
Right. And maybe some time of paid consultants as well. I'm not sure it's within the scope of our current consultants, but that is also something to consider is who these folks would be if they'd be paid, and if so, do we need more resources for that? Do I hear any proposals for work group versus subcommittee? I would think, I mean, this board has already established a process for our own committees that we need at least one board member on every committee and specifically to chair that committee. We currently have 2 board members on all of our committees. And so I would think that if we did a subcommittee, it would be reasonable to say there has to be at least one member of the committee on the subcommittee to be sort of the link. So that would be useful. But other than that, it could be comprised of whoever we want. I'm not sure the advantages of a subcommittee versus work group. I don't feel strongly either way, but I don't know if other folks have.
I think work group seems like Michelle said, kind of more short term, where the committees are kind of, you know, ongoing through our work process. So I think that's kind of the distinction in my mind.
And the work group would not require a committee member or a board member to be on it. Yeah.
Which gives flexibility.
Gives flexibility. They could be on it, but they don't have to be on it. They would just report to the plan design committee.
And you also.
Yes.
Oh, I see. A work group of the plan design.
Yeah, right. So am I hearing support more for a work group that would report to the plan design committee? Yes, I'm seeing nodding heads. Okay, so we'll change some language in the straw proposal to reflect that. It will be recommended that members of the plan design committee and certainly the board, thank you, Amy, be part of that, but it's not required. Recruiting for that, we will tap into our resources to figure out who we can recruit for that and if there will be a resource need in terms of finances to pay for it, or if we have folks willing to do that for us without pay. Okay, Judy, did you have something?
Thank you. Yes, I will just add a request that plan design clearly define the scope in terms of deliverables and timeline for a work plan, as well as then associated resources that will be allocated to the work group. So clearly define who do you need, what's the question you're trying to solve? Who do you need on this work group? What resources are going to be available so that they understand their charter and we know when it's finished.
Yeah, absolutely. Thank you. Amy?
I'd like to propose that there's a combination of people, you know, from the DDS and other worlds that we're trying to address with the work group and people with lived experience.
Great, thank you. Michelle?
Just noting that we actually have some definitions in our adopted policies that might be worth reviewing before finalizing language. I don't know that it matters. I think we're all coalescing on like what we need in terms of composition and duration and who it reports to. But item 14 on page 7 of our adopted policies does have some definitions of what a work group is and what a committee is and requirements for those. And so I think we don't need to deal with that in this meeting, but we should probably consult that before finalizing what we call whatever it is.
Great, yeah, thank you for that. Okay. But the authority to kind of create this work group and work out the charter and details lies with the plan design committee. We'll let that group kind of come up with that and report back. Great, Chun-Wei.
Just a quick clarifying question. Will the task of this work group be focusing on long-term care in general or long-term care in the scope of mental health and behavioral health?
Long-term care in general, with a reflection on how the influence that would have on the long-term care services for behavioral health. Yeah. Amy, go ahead.
I just need to clarify, people with intellectual and developmental disabilities don't necessarily have mental health issues, but many do have co-occurring mental health issues because of systemic ableism. So I just want to clarify that, just making sure that wasn't getting conflated.
Thank you. Anything else on that? Debbie, do you feel like you have what you need for those two straw proposals? Okay. Okay, so we can move on to operations for the next 10 minutes, 10, 15, or we take a break. You're good.
I think we can probably do it in
10 minutes?
less.
Okay, cool. Then we'll move to operations.
Okay, so this is we have a proposal which hopefully you all reviewed. The issue is about public corporations. We've talked about the fact that legislation calls for us to create a plan that is a public corporation. That sounded really easy. It actually is much more complicated than you would imagine. We spoke with several different public corporations, Willamette Locks, SAFE, OHSU, and it turns out that all are different, that the term public corporation can mean a lot of different things. And it's actually very important that we be aware of that there's no single structure of a public corporation. And so we consulted those folks. We actually had the SAFE and OHSU teams, the lawyer at OHSU that created their public corporation come talk with us. And we learned a lot. And the issue is that you want to be certain that on one hand, we have a public corporation that's subject to public ethics and transparency and public meeting law, but that we are exempt from a lot of the statutes that apply to state agencies. So, for example, things like having an attorney, that you could have an attorney that isn't part of DOJ, that your employment system doesn't have to be the same as the state system. SAFE and OHSU and Willamette Locks have their own employment systems. So, in essence, our recommendation and what you'll see in the proposal is that we should be a public corporation. And at the appropriate time, we need to have legal counsel carefully review every statute to ensure that no statute would impede our ability to function flexibly, but still be able to be an organization that is transparent and accountable to the public. So in essence, exclude all laws that apply only to state agencies and include those laws that apply to public bodies broadly. So that's in essence what our proposal says. I don't think we're at the point right now where we want to go through that laborious process. That's something for a later stage. So let me stop there and see if there's any questions.
So just to clarify, so this entity does not exist within state government,
What entity?
the public corporation. Is it part of state government or not part of state government?
Yes. I think that's the answer.
It is.
It is a public corporation.
Yeah.
Which is partly a part of state government, but also very different from state government. It's a very unique designation. And there's only, what, 4, Jenny? States.
And it's OHSU, SAFE.
Willamette Locks.
And Fairgrounds Commission.
Oh. Willamette Locks is for the locks like on the river? Or
Yeah.
Okay, just. Okay. So they have some accountability to state government. Is there?
As a public body, yes. They're not a state agency, but they are transparent, they're accountable to the public, they're a public body, and they are accountable to the same public meeting and records laws that government is. That's what makes them quote unquote a part of government.
What's their accountability to the legislature? Is there any?
No.
So they're accountable to the public, but not necessarily to the legislature. Yeah.
That's my understanding.
Mhm. They could get funding from the legislature, and they do. Yeah,
Yes.
yeah. It's really interesting.
And questions, does Oregon state has the entity called public enterprise, or are they simply called public corporations?
You mean Oregon State University?
No, state, the
The
state.
state.
The state government, does it has a separate entity called public enterprise?
I don't know. We could look that up.
Or they simply, the reason I ask is, if there is such entity called public enterprise, my question would be, what's the difference between public enterprise and public corporation? For example, when Taiwan established universal health care, initially it was under public enterprise. And public enterprise still is a government entity, but they follow different rules. But then about a decade ago, because a government agency has better benefit, so that the public enterprise entity governing the universal health care, they went through legislation change from public enterprise into government agency.
Well, we can look that up. My sense is the one structure is the public corporation. And that Chun Wei, you had asked a question that I looked at and wanted to answer. You had asked about what happens to this board. But by definition, this board would go away because the public corporation is a new and separate entity. None of us have been appointed as members of the board of the public corporation. If indeed a public corporation were established, a board would need to be established. And it isn't necessarily this board. It becomes a different thing.
In that regard, I would recommend towards the end, before we establish the public corporations, the board may make a recommendation that there should be a governance board overseeing this public corporation that is totally independent, separate, not part of the public corporation. And that's how Taiwan's government established. They have a National Health Insurance Administration, but then separately under the Ministry of Health, they have something comparable with governance board. That has nothing to do with the Health Insurance Administration. They are totally independent, but their role is to supervising, governing this board. So that's what I would recommend, rather than be part of the public corporation.
Not sure how that would work. Because the public corporation has a governing board that would be appointed by the governor and confirmed by the Senate. You're saying that they would.
Well, as long as it remains independent, that board should be independent from this public corporation.
It is independent. That by nature is what the public corporation is. They have their own, that they govern their work. They have their own personnel systems. They are independent. They make the decisions. They're not made by any other governing body.
And my main concern is how, when we establish that public corporation and when we implement the universal health care, how we maintain the Oregonians' participation in key decision making, in policy making, how we maintain that mechanism and institution.
Yeah, I think the public corporation system continues that by having board members that are appointed by the governor and confirmed by the Senate, so that you have board members that are, in essence, fourth and are extensions of the public because it's elected officials that appoint them. But then they are free and independent in their decision making.
Decision making about implementing, but would they be able to change, say, all of, the things that are being decided here as to what's covered and all of those things, once they became their own thing, then they could say, well, no, we don't really want to do that anymore. We're going to cut that out. I mean, I don't know who gets the decision on the plan that we design, and then it goes over to this other group that, various people, and I don't want to malign any of the public corporations that we have. But I certainly, as a member of the public, don't feel very connected to what happens at those two places, namely OHSU and SAFE. So I don't know. I'm just trying to figure out whether all of this work, design something, gets it all set, says this is how it is, and then hands it over to some other people who then say, no, we really can't afford that, or we really don't want to do that, or we really don't like that, so we're going to change it. I don't know.
I think ultimately that is going to be the purpose of the governor and the legislature.
Okay.
You're not going to have an independent body that becomes its own action authority.
Okay. All right.
So the fund is going to exist in the treasury. So there's going to be some relationship with current government agencies because of that. So like, what is the relationship with OHA or DHS then? Would that need to be established, or?
It isn't necessarily one. Fund in the treasury has nothing to do with the relationship with the state.
Right, but what I'm saying is like, there will be some connection to current state government agencies. For example, the fund is in the treasury. So is there a relationship between this board and OHA separate from the fund? Like, or is the implication that this would be a massive change for the Oregon Health Authority as well?
Yes,
Yeah.
massive change for the Oregon Health Authority.
And
Because
DHS.
this new board would now have oversight over all the healthcare benefits.
Medicaid and everything.
So it's to work it shifts
Yeah.
over.
That's why that's being a public corporation and existing, again, you exist outside of state government, but still accountable to the same transparency and public meeting that that government is beholden to.
One concern would be, again, I'm using Taiwan as an example. Taiwan's National Health Insurance Administration is under the Ministry of Health, so that assures there's seamless connection between health care and population health promotion. And so it's easily, seamlessly, within the National Health Insurance, all the important services regarding health promotion and prevention are part of it. And because this is under the same umbrella of the Ministry of Health. But if this is totally independent, say from Oregon Health Authority, then how can we make it smooth connection between healthcare and population health promotion?
Good question. I think it's something that would have to be designed.
Said less than 10 minutes. But to be clear, the straw proposal right now is saying you're asking the board to consider creating a public corporation and having legal review of any statutes that would impede the work.
Correct.
That's the limit of what we're talking about right now. Right.
There's obviously many more details that need to be worked out, but not at this time.
Right.
I think particularly Chun Wei's point about how you integrate public health and in a new system.
Mm-hmm. Any other questions or, oh yeah, we do. Judy, go ahead.
Thank you. I was just going to make the point that you made, Chair Blanca, that the straw proposal is asking, is this public corporation the right direction or is it not? And I want to, at this moment, thank Jenny Donovan for all of her work showing us what we don't know, because there's a lot of legal details in the structure and design. And I think that those relationships can be clear and should be clear and delineated in the design of the public corp.
Michelle?
I support this going in this direction. I think that this question is already coming up in public engagement. I got this question when I spoke to Healthcare for All Washington last week, and I think it's going to continue to come up, which makes sense. And I think as is pointed out in the straw proposal, this is the first deliverable, and so I think legal review is a really great way to make sure that we're creating a solid foundation. So thank you for bringing this forward.
Go ahead, Judy.
Thank you. And I will only add, like OHSU or not, it is the best precursor or model, whatever, for public corp that we're looking for. There are specific exemptions that allow OHSU to function as a health entity, although they're still subject to public meetings law. Those board meetings are public. The board is appointed by the governor's office. There are many, many similarities that help. However, there are exemptions for procurement that help get things done in an expedient way, especially when you're talking about the health and wellness of people.
I would just add that, my sense is that we only sort of broadly two structures. One is to be part of state government, the other is to be a public corporation. And that we can, there is no clear single size definition of a public corporation, but it provides for the transparency, and that what we need to do is work out many of the issues that were raised here as we set up that statute, but that to me, it doesn't make a lot of sense to go try and create some new kind of structure that doesn't exist, but that what we learned is there's actually a lot of flexibility within the public corporation authority that allows you to create a corporation that meets the needs. And it's balancing out operations and accountability to the public and transparency.
So our role is either to approve this straw proposal as is or to add any revisions. Is there anything that we heard during this discussion that would require a revision to this, or should we approve it as is? As is? Okay, so is there agreement that we are going to approve this straw proposal as is and send it back to the operations committee to continue working on it? Yes. Okay, good. 5. Anybody disagree with that? Okay, great. Thank you.
I did say 5 minutes, but I also said you'd think it was easy, but it really isn't.
That's true. That's true. Okay, so let's take a 10-minute break. It is let's come back at 10:50. Is that okay? 10:50.
Amy, I just want to do an audio test. Can you hear me, Amy?
Yep, hear you loud and clear.
Thank you.
Okay, welcome back, everyone. So I'll start by saying, does anyone have any comments on the overall direction of the committees? I'd like after all the committee updates, I'd like to just pause and say, from what we've heard, do we feel like we're all still moving in the same direction? Anyone want to sort of make any comments, suggestions, or observations about the committee work? Yes, Michelle.
Thank you, Chair Blanca. I've been struggling with how to create clarity and check for consensus on the CECC scope, particularly as it relates to broad public engagement versus targeted strategic engagement with the specific groups named in the bill. And I struggle with that. I don't know, it doesn't seem like a straw proposal because it's not like a new proposal. It's really just checking, like kind of laying out the way that Amy and I and the committee have been thinking about and discussing how this will work within the timeline that we have, first and foremost, and to do the level of quality work that we are committed to doing in an iterative process with these other committees that we're coordinating with. So I don't know if you want to do that now, if you want me to save that for strategic planning, but I just want to name it as something that I've heard in board discussions, different things. And I do want to, before moving much further, make sure that there is consensus on what our scope of work is, and specifically, to name it, consensus that we do not have the adequate time or resources to do iterative work to take the plan design and the finance and revenue design out to these specific groups, get input, bring it back, incorporate it, and do strategic communications for this draft plan by September of 2026. In addition to that, do a full broad public engagement process. That is outside of our scope, outside of our timeline, outside of our resources, if we're going to do a good job at either. So just want to name that, and happy to save that for strategic planning, or bring it back to the board written up if you prefer, but wanted to name that piece that I want to make sure that there's consensus on, and hear any board thoughts on that topic.
Yes, it's actually a great point, and it leads right into the strategic planning discussion. So we can just put it in there. I think to some extent that might be true for all of the committees, that we are at a really crucial pivot point right now in our work. We've been convening for a year. We've all sort of dug into some of the details of our work plans with our committees. We've learned things we didn't sort of account for before. And we have a better sense now of what we're supposed to be doing. So when we created our work plan with all those work streams, we were right at the very beginning. We hadn't done much of the digging in yet. And right now is a good time to just reflect on that work plan and the deliverables of each of the committees and the scope of each of the committees, and make sure that we are headed in the right direction. Judy and I have been talking, and months ago, we thought that April might be a good time for us to dedicate our whole meeting to like a strategic planning session, to kind of take a fresh look at our overall plan and figure that out. To that end, Judy in just a moment will go over a worksheet that she wants us to kind of consider working on over the next month before our April meeting. And then I'd like to spend some time now during the meeting, just kind of taking a broad look at our work plan and pulling out any high level changes or considerations that we need to make in it. And then in the intervening month, Judy and I and our consultants and our staff can sort of think through our work plan and then be more prepared for a deep dive into a strategic planning session in our April meeting. So Amy, did you have a comment there?
I just had a question, and you might get to this, but I just was curious if we need to make plans for the April meeting? Is it going to be longer? You know, is it
Yeah.
important that we're all there in person, all those kind of things? But you might be talking about that next.
Yeah, that's where we're headed. So let's tee up that discussion about what that April meeting might look like with a couple of intermediate steps. And I'll start with having Judy go over her modeling for how we can start to think through this.
Thank you, Chair. Let me just check and see. Great. So, thank you. Friends, we all have homework, and I will explain what that is in a minute. This is a tool that, once I describe it, you'll be familiar with what it is. I've used it with graduate students before in defining a gap analysis. So you see on the left-hand side under A is a description of the current state. I this is not completed. I started this one thinking of a very, very high level view of health in Oregon. We'll go through the details of the assignment per work stream and committee in a minute. So this is just to give an example of how this kind of a tool will work. If you're used to project management, perhaps, this is where you would put the work breakdown structure of the different packets of work that will come together in the ultimate deliverable. As I mentioned, on the left-hand side is a description of your current state. The next step is to define the ideal future state, and that goes on side B, where the bridge is coming over. That is the hopeful future vision that we all share for Oregon, in this case, at the very high level view, a universal payer plan that is efficient, affordable, and equitable in its system and design. And that gets us from the current state to the future state. In the gap, we're defining two things. One is stepping stones. Are there real, tangible, indelible, mini deliverables, if you will, that will eventually help us get to that future state, but that they last regardless of whether or not the future state has been accomplished? So for example, Oregon passed Measure 111, which established healthcare as a human right, which seems like an indelible stepping stone that's in the middle between the current state, but will help us step on it and take us to the future state. Also consider the establishment of the Universal Health Plan Governance Board as an intermediate stepping stone. There are short-term wins or process measures in between this gap that are needed to accomplish the future state, but may not themselves be an independent stepping stone. And so if you go to the next slide, Katie, this is just an example. Plan design, please erase all of this when you do your homework. But in the packet, there is a template for each of the committees, as well as a blank template to jot down ideas. Our intention is that you'll think about this prior to our next board meeting, write some notes for yourself, specifically about the committee that the subcommittee that you serve on, but also you can make notes for other work streams or even independent of the committees. If you're thinking, okay, there is an intermediate step, a win, a quick win, maybe not so quick, but before we have the desired future state that is related to this work that we can accomplish. And I'll discuss what that might be at the end. So for example, plan design gave us a great one in the straw proposal, that an interim step would be to augment the current benefits offered by PEB with behavioral health benefits covered by OHP. So if plan design can figure out how to nudge PEB, influence PEB to expand those behavioral health benefits so it's on equal footing with OHP, that's something that will live and improve benefits for Oregonians, regardless of achieving the future state. It will definitely get us closer to that future state, but prior to that, it's something that is a stone to step on that is a win. This is really a bad example, defined basic health services package, because we can do that. That's an intermediate process element, but it wouldn't live itself outside of the desired future state, if that makes sense. I think that's the only one that we included in the packet. Once again, the intention is to use these as worksheets, jot notes down. You can definitely describe the current state with as much detail as necessary to relate to that future state element, and then ideas for the steps in the middle. You don't have to have the through line completed. You don't have to know the connections between the current state, the step, and the desired future state. We're going to do this together as part of our next board meeting and doing strategic planning. We'll do it on a big board, and then we can consolidate that into a single document for review and include, exclude elements, combined elements, perhaps. Questions at this point?
So Judy, it sounds like the way we're talking about it is like we have this idea of what our final deliverable is, and there are certain steps to get there. Like in this example, we need to define the benefit package for the universal health plan. That would be a step to getting to our future state. But these stones, like kind of in the middle, that could exist on their own, would be, you know, yeah. So within that benefit package, defining what coverage there would be for long-term services and supports, or defining an expanded behavioral health package. Those, if we were to accomplish those, yes, get us closer to our future state, but also could be part of the transition as we're going there. As we all sort of realize, I'm sure this would never be like an on-off switch to this future state. There's going to be a whole number of system changes that would need to be in place in order to make that future state possible. And if we can start identifying some of those intermediate wins, that would facilitate us getting there over the next few years. Is that right?
Yes, thank you. And I don't want anyone to get stuck on defining like what's a step, what's a stone. We'll figure that out together. This is just an opportunity to do any little bit of extra work or packaging that we may need to do that creates something that lasts, that is indelible, that is it's an immediate win that leads us to the future state. And so that's what we can pull together. Now, if the resources and the work is too broad for that step, to define that step, then that's perhaps something that the work group or the committee doesn't want to take on. But if it is, what they say in business, if the juice is worth the squeeze, if there's just enough extra work that makes that something that's indelible. Healthcare is a human right is a good example, because we have that now codified in Oregon. That's a very helpful step to lead us to our future state.
Go ahead, Maria.
This is maybe funny here, but your nice little design of the bridge, I guess for me, with the current state, the bridge is a good on the whole picture, but really, in my mind, the part over here under the current state is it's kind of falling down. It's kind of crumbling. It's not looking so pretty over here. So just my graphic, if it could be done, would be have the bridge looking a little dilapidated on this side and looking really good on the other side. That's kind of that's all.
So we're each going to just take a little bit of time between now and our next board meeting to kind of think this through in terms of the board's work overall, or your specific committee work, and just try to identify some of these smaller packages of work. Anything that you think we may be missing from our current work plan, pieces of work that we haven't identified so far that aren't included, or observations that you've had as your work has progressed. And we'll go into this in a lot more detail at our next board meeting when we dive deeper into our strategic plan. But for now, think about it, jot things down. It doesn't have to be complete ideas like Judy said, and just kind of bring your thoughts back next time.
Where is that worksheet?
I'll send it. Good question. Yeah, I'll send every committee chair theirs.
That'd be great.
And Katie, I'd like everyone to get the whole packet too, because you may think of something that's related to your committee work, or not, and that's totally fine. These are worksheets that are not permanent. We're going to bring them together. So use it only as a tool. Some folks, I'm very visual, and so I like to draw things and write them down. And some people maybe are not. So it's just a tool for that.
Yeah, don't feel constrained by your committee. I think that's a really important point if there's other pieces. Yeah. Okay, so let's take a few minutes and go through the work plan. And the goal here is for us to just refresh our memory about what's in each of these work streams. And see if there's anything glaring that's missing. This is not editing the wording. This is not sort of super detailed. We just want to like get your reaction as there's some big piece of work that's missing. So this is phase one. So this is our prep work in terms of building understanding of single payer and getting some orientation, reviewing values and principles, understanding what the task force recommended, and selecting the general financing structure. Okay. So those were in work plan phase one. Mostly where our committee's work is in work plan phase two. So this is proposal development. So let's start here with community engagement.
I put objectives on one and then their tasks and deliverables on the other to make it readable.
Make it readable. So we can just read through the objective of this committee. So listening and engaging before, during, and after. The specific interest groups are listed there. And then identifying strategies to reduce complexities and administrative burdens. So here's the list of tasks. Establish a community engagement committee, review joint task force recommendations, identify strategies to engage with communities and stakeholders, engage with federally recognized tribes, businesses, providers, clinics, CCOs, CBOs, disability-led organizations, and insurance carriers. Develop a plan for general public outreach to engage through the Finance and Operations Committee. Engage with small and large businesses, particularly in development of the revenue and finance development. Present feedback received through community engagement efforts to the governance board committees and to the board to inform decisions. So in that list of tasks or in the objective, are there high-level things that you feel are missing or need to be changed?
I guess I'm going back to Michelle's earlier comments. Michelle, you and I talked about this. We're just kind of chatting and trying to meet with all the new members to tell them who I am and find out who they are. And so one of the things that we discussed on the phone was what you were bringing up earlier about the timeline and the resources to really engage in a broad public engagement versus with the groups that were identified in the law, which is what you feel we do have time and resources to do. So I just was wondering, Michelle, are you doing that kind of discussion today, or does that come next at the next meeting?
Timeline we can put on hold for now, but really let's focus on the tasks, and if the tasks accurately reflect the work. If the timeline needs to be changed, we know they go together, of course, that the tasks that you can do are dependent on the timeline. But is this the work that we want the committee to do? And if so, do we need to adjust the timeline or the revenue or other resources?
I would just say that I think from our perspective, these two words, general public and before outreach, I think might be where some of the confusion is coming in. Certainly, I think we do have a plan for engaging through finance and really plan design. And I think there will be some materials that will be developed that were already identified by the committee that Patty Wentz will be able to kind of hone and fine tune that can be shared out more broadly. But I do want to be just really clear in all of our documents that we cannot effectively do general public outreach. That is a specific thing. It would need a whole nother consultant, a whole nother contract, and more time than we have. And so I think it might just be helpful to everyone if we say develop plan for outreach to engage through the finance plan design and operations committees But you know, I know you said we're not wordsmithing, but I do want to make sure that there's clarity and consensus and that there's not confusion and or frustration because of miscommunication or different understandings of how this will work.
Yeah, I think that's a reasonable request there.
Yeah, I just want to agree with what Michelle said and make sure that we do add plan design in that sentence, because that's our current plan.
Anything missing from this that you've uncovered in your work so far that we need to make sure is included as a task?
I think the only thing that's missing, and it's not just relative to our committee, but I think it's something we're all figuring out together, which is aside from straw proposals, how do we effectively send things from one committee to the other? What does that communication flow look like? I think because we were the first committee established and up and running, and we had a really eager, smart group of committed leaders in our committee, we developed some materials for the other work groups. And like last year, like a scan of all of the feedback that had been shared recently about healthcare services that Oregonians felt were important or working or what wasn't working. And I don't know that that ever reached anybody. So I think that piece for what how this iterative work works, aside from reporting out or bringing a straw proposal, is something that I think we are still figuring out.
I think that's a good task to add. We can make a go at that. And again, we'll have a chance to look at these again as part of strategic planning. We're just trying to identify things that need work, so we can make note of that. Yeah, go ahead, Amy.
And I think, I mean, this is for when we get into more in the weeds, but kind of figuring out a process across the board when we get requests for speaking engagements, like how we divvy that up amongst all of us, because it's not feasible for Michelle and I to, you know, like kind of do all of them. I know other people have done some already, but just kind of, it seems like it would be good to not every time we get a request through staff have to figure out, you know, a process, but kind of have some kind of process for that.
Yeah, that's a great idea. Yeah, we should add a task about that. Thank you. Yeah, go ahead, Mary.
But 5.5, we're talking about develop plan for general public outreach to finance, and then you're putting plan design and operations. I'm not quite sure what through the I mean, since I'm going to join this finance committee, whether it's through us or what is exactly.
Maybe it means with.
From or with or something.
Yeah, with
Okay.
those committees. Yeah.
All
So
right.
the idea is what
We're
Michelle.
not going to be out community engaging from the finance committee.
No.
Okay,
It's just like
that's
there's a reciprocity, right, Michelle? Is that what you were gonna say? Just getting information from them?
And I think if you look at the timeline visual, it's more clear. The way I interpret it is through the duration of those committees, the duration of their work.
Any comments about the deliverables? This is pulled right from Senate bill language. Okay. Work stream 2 is communication, same committee, develop plain language materials, materials in additional languages to communicate the progress and the final universal health plan, develop messages, talking points, and one-pagers in support of the transition to universal health plan. So tasks, identify what materials are needed and the best messages. Seems like you're well on your way with that work. Any comments on the tasks or deliverables for this work stream?
Just again, just a note of caution on the create a dissemination plan to the final report to ensure full public knowledge. It's a great thing to shoot for. I don't know what that means, full public knowledge of a new, you know, a new universal plan, how we would measure that, but
Maybe we just strike that last phrase, just create a dissemination plan for the final report.
sure.
Okay. Moving on to work stream number 3, which is finance and revenue. Objective is to design a unified financing structure for the Universal Health Plan, including creating a Universal Health Plan Trust Fund in the state treasury with sufficient reserves, study and address the impacts of the Universal Health Plan with respect to specific types of employers and households, and consider funding mechanisms within the context of perspective of ERISA challenges. Of perspective, there's an extra of in there, within the context of prospective ERISA challenges. So task lists, attributes of a sound financial plan, review and understand current health spending, develop an annual health plan cost target that can be supported with new revenue, review methods of revenue collection to withstand ERISA challenge, review, update, and build on revenue options, describe the impact of revenue or taxes on large and small businesses and households, identify required startup costs and plan reserves, develop strategy for building needed reserves, compare and contrast current mechanisms for funding healthcare with proposed financing strategy. Any comments on the objective or the tasks? Anything that's glaring that we need to call out or make different? You have the very small deliverable of a unified financing strategy for the Universal Health Plan that may include an income tax, payroll tax, or other options that take into considerations ERISA and support from large and small employers, and then an analysis of the impact of that plan on the overall Oregon economy. So good luck.
Yeah.
It made me feel better to hear that we also have some additional resources in Millman.
Oh, yeah.
That would put them way past.
Yeah.
And so that
So no comments, critiques, anything missing or inappropriate in here? Okay, moving on to workstream 4. This is plan design. The objective is to review any needed changes from the Joint Task Force recommendations to benefits, eligibility, and provider reimbursement plan design to stay within cost estimates and revenue projections by the Finance Committee. Tasks, reviewing the benefit plan outlined in the recommendations of the task force, update expenditure estimates, evaluate benefit plan and provider reimbursement plan relative to cost targets, review and discuss options for cost containment in the Universal Health Plan, identify strategies to address quality of care for consumers, discuss workforce needs and develop recommendations to meet healthcare provider and other workforce needs. Some editing there, but but in terms of broad stroke tasks, what this committee is being asked to do. Yes. Chenmai.
Just a suggestion of wording. I suggest we consider replace consumers with either beneficiaries or Oregonians. Because the term consumer is used in commercial insurance. And generally in universal health plan, we don't use that term. We use beneficiaries or residents.
my only thought as a newbie here is that it's kind of a chicken and egg thing with the Revenue and Finance Committee and the Plan Design Committee, you know, kind of putting these cost estimates and doing whatever. It's kind of like, we need to know some stuff and then come back and forth. So it doesn't really, in my mind, reflect so much the iterative process here, but that just.
Yeah, that's one of our most common sort of discussions in the sense of, yeah, which is first, and where we landed is let's come up with a reasonable revenue structure and then take our best guess at plan design and then do some reconciliation work. And Cheryl alluded to that, that sort of joint reconciliation of the two is coming up. But what has sort of sunk other efforts like ours in the past has been to focus so much on building this really cool plan design and then realize you don't have any kind of revenue structure that would come anywhere close to supporting it. And so our goal has always been, let's really understand what's feasible and reasonable in terms of a revenue structure, come up with a basic cost of that, and then see how closely we align. The benefit design, we've always thought of it as a kind of a must-have list and then a nice-to-have list and see how much we could incorporative are nice to haves, you know what I mean? And just working through that reconciliation, and that's where that would go back and forth. But we're doing them sort of simultaneously with that idea that they will need to be reconciled. But you got to have a sound financial structure and really understand what our even options are for
And then
revenue.
it would seem like the outside consultants, the actuaries, that piece will help us. As, I mean, just the straw proposal today with all of those things. Many of which aren't really happening for everybody and kind of like, love to have it. But how do we, and you know, and even how do we cost out what that would be, because the population that's on the Oregon Health Plan is different.
That's
than
right.
That middle population you're talking about, and so it may cost less or more, but it's like trying to figure out those kinds of pieces that, you know, glad we've got some expert consultants.
Yeah.
Yes. And it ignores the whole issue of workforce. Like, even if we did cover all those services for that many people, do we have the workforce to meet those needs? Yeah.
Otherwise, with Cheryl issue on communications.
Right. Yeah, Michelle.
We're
Thank you, Chair. Speaking of iterative, I'm curious, I'm realizing that we don't have any tasks related to incorporating feedback that comes out of the public engagement process. And maybe that's implied and we don't need it, but if we're planning with consultants and designing scopes of work and things like that, it does seem like that would need to be accounted for by both plan design and finance and revenue. Once we present that feedback back, is there capacity in planning for incorporating that feedback before our final report to the legislature?
Yeah, that's an excellent call out. We should definitely add a task to that effect. Yeah, go ahead, Debbie.
And just the last one, the discussing workforce needs and developing recommendations for those. I just wonder what's the timeline, just seeing where we're at this point and how long I anticipate. Like, I think we made it how many meetings it takes to get through just a single topic. And so I just wonder about the timeline and how feasible it will be when we'll be getting to the point of that being ready to discuss workforce.
Is it a reasonable task for this committee, and just you're worried about the resources needed both in time and money to get there, or you're saying it's not reasonable for this committee to take on that piece of work?
I think I just worry about the timeline. I think it straddles a little bit with the transition.
Yes.
And
Yeah.
so I just want to be like, just as it's written, it just feels a little all encompassing and nebulous. And yeah, I just worry about like what our actual deliverable on that is.
Yeah, I think that's excellent. We can put something in there that might lead over more into transition work. And that we should consider additional resources. Yeah. Go ahead, Chenry.
Cheryl first.
Yeah. Oh, sorry, Cheryl.
I'm not sure which committee this lives in, but we've talked about it a lot in the Finance and Revenue Committee. And that's coming up with some kind of cost calculator mechanism. I think it could be part of all three of these committees: plan, design, communications, and finance and revenue. So I wanted to make sure we incorporate that somewhere. And I think the second deliverable is starting to get to that, but maybe not exactly. I'm not sure where that goes.
When
But
we've talked about it before, we were talking about a model where people could go in and say, what are you paying now?
Yeah.
What would it pay? What would it cost?
so both for the individual who's getting the benefit and also for the employer, all those people who are concerned that it's going to cost them more. So whether it's the individual who's having the health benefits or the employer. And I know those figures will come from the Finance and Revenue Committee,
Yeah.
but I'm not sure if we're the ones developing the actual mechanism, the cost.
Right. We had some concerns about like how that alone is like such a huge, like, I know they have been developed before, but I'd be really interested in asking our consultants what it would take to build such a
Yeah.
cost calculator and then getting so I'd be amenable to putting a task. I kind of think it belongs in finance and revenue, a task in there to say, to estimate so what would it take to model this cost transition calculator for consumers and businesses? And is that a reasonable thing? Are there, who knows, there may be something that's already mostly there that we could just tweak and it wouldn't be that much work to get it implemented, or it might be like, wow, that is going to take 6 months in and of itself to build that, and we may not want to take that on. Also could be part of the transition committee work as well. But for now, I think adding a task about bringing it up with our consultants and saying like, what would that take to make that happen? And, right. Okay. Anything else? Yes, John.
I have a very question regarding the reimbursement plan. Reimbursement plan is a massive work. So my question is, one, in terms of procedure, whether the board want to give direction, the general direction or principles. For example, should we consider global budget or should we consider the current OHP payment? So I have two related questions. One is procedure in terms of whether the board want to decide or choose the direction, a general principle, and let the plan design and expenditure committee to do the detail, or the board want to wait for the plan design expenditure committee to come up with options, suggestions. So that's a procedure question. And then second is, since this is a massive work, if we are shooting September 2026, we may need to have a timeline when we should get started and when we at least to have a general direction or principle.
So the task force did quite a bit of work on the provider reimbursement strategy, and plan design is going to be sort of learning sort of what they worked on and what they came up with in terms of that. I think for now, my gut feeling is that we would let that process happen in the committee and see what they come back with a straw proposal, but then that this board really look at that straw proposal very critically to make sure it aligns with our overall goals and plans, and that will be a very robust, I think, conversation about what that provider reimbursement looks like. But I think, unless folks disagree, I think like letting the committee sort of wrestle with what the task force did already and come to us with a straw proposal for that would make sense. Does anyone have other ideas or suggestions? But you're right, it is a huge discussion. I think this is an opportune time because now this is like the 8th time it's come up that I think our overall timeline is in question. And especially with the staff changes that have been going on, we can talk sort of once we get through the rest of the work streams about our overall timeline, and if this board feels like requesting an extension on our timeline is something that we would request of the legislature. So we can talk through that as soon as we get through this too, because it's a ton of work. Okay, anything else on so let's look at the deliverables for plan design. So the deliverables will be final recommendations for the universal health plan benefits, eligibility and reimbursements, and then workforce cost containment and quality strategies. Quality is missing from that one too, but it's mentioned above. And then, so this is financial modeling and actuarial analysis of various plan options that include expenditures and savings. I would add in there in consultation with the finance and revenue, or sort of partnership with them. We're not going to, that's not a deliverable. Plan design would be responsible on their own. That would be sort of a joint deliverable. Anyone else have thoughts or additions, edits to the deliverables here?
Just a quick suggestions. The reason it's massive and complex is because it's closely tied with cost control and quality.
Right, exactly. That's why they're all in that same bucket. Right. Okay. Last.
So are we adding costs to the quality piece?
We're adding quality.
Identify strategies to address quality of care.
Yeah, so that's there in the tasks. I would suggest adding it to the deliverables as well.
Oh, there, yep, there it is. Okay, great.
So that first bullet under deliverables should include workforce quality and cost containment strategies. Okay, work stream 5, operations. The objective is to design the Universal Health Plan administrative structure based on recommendations from the Plan Design and Expenditures Committee and approved by the board. Identify the statutory authority and IT infrastructure needed for plan operations, and identify potential interim strategies and or legislation needed to transition to the Universal Health Plan. Engage with the Governor's Office, the Oregon Health Authority, and federal authorities to ascertain and describe the necessary waivers. Identify strategy for obtaining necessary federal waivers. We moved the transition to its own work stream.
I'm just gonna bring that up.
Yes, I was anticipating that. So we can remove that from the objective here, because that's its own. So the first part of that sentence, identify statutory authority and IT infrastructure needed for plan operations, period. And then the second part after and would go to the transition committee. So the tasks, review other public corporations in Oregon, understand administrative structures, identify IT needs and systems, review complex healthcare organizations, including approaches to claims management, quality, population health and security, determine how to manage eligibility and enrollment, recommend an admin structure, and determine operational costs. Deliverables, recommendations on the admin structure, recommendations on statutory authority, workforce and IT needs. So we have workforce here and in plan design. Not sure about that. I think there is probably a role for both committees. It probably is some overlap. Just pointing that out. Plan to create a trust fund in the state treasury and how to route revenue to the fund, determine startup costs and source of funding. Plan to create an independent public corporation to run the Universal Health Plan, identify federal waivers, and create federal waiver guidance document on necessary steps to get those waivers. Thoughts, comments? Yeah, go ahead, Chenmei.
This might fall into the task, is also for the operation committee to consider. One is to how to establish the uniform claim. Because right now, all health insurance company has a different plan, but under universal health plan, they need to. And related to that, also tied with IT, how providers using the uniform plan online can send claim to the public operations. And then related to that also, these are all related both to the uniform claim as well as the IT. And I'm using Taiwan as an example because Taiwan has probably the world's most advanced IT in terms of universal health plan, that all providers have access with the consent of the patient. When the patient show up at any provider, clinic or hospital, their computer all connected to the central server. So the provider immediately have real-time access to the patient's record, and that also prevent duplication of prescription, duplication of diagnostic testing. And so these are all tied in uniform claim as well as the uniform central service system. And I suggest that might be a task the operation committee can consider.
And I appreciate your raising that. I've always assumed that was under the recommendations on IT, plan operations, et cetera, and claims processing. But I think calling that out specifically is a good idea. I think I've always thought it was assumed as part of that.
Any other thoughts or comments? Okay, and then just briefly, we can look at our final one, which is the transition and implementation plan. So the objective here is to identify the implementation strategies for moving from the current fragmented multi-payer employer-based health system into a universal health plan, develop a readiness assessment of key partners and state agencies, engage with regional organizations to identify strategies to reduce the complexities and administrative burdens on participants in the healthcare workforce. What? And to otherwise address workforce challenges. Yeah, so workforce is part of this one too. So a little bit of editing of the wording here, but basically this is the how do we get from here to there group. This board agreed that we weren't going to establish this committee right away, that we would do some of this preliminary work first and then convene that transition committee when we were a bit farther along. So tasks, identify transition steps needed to move from status quo into the UHP, develop and conduct a readiness assessment, review existing reports on workforce challenges and identify strategies to mitigate those transitions, develop and conduct readiness assessment of healthcare system and industry, identify the impact of the plan on the current health system workforce, determine transition costs. And then the deliverables are to do those reports on those readiness assessments, implementation strategies, and legislative recommendations. Yeah, Bruce.
I hate to be a broken record about this, but you know, one, I think having a transition plan that people have confidence in is really going to be key to this whole thing. I don't think we're given 6 months to do this. I don't think it's possible to do a readiness assessment of the healthcare industry. I don't think it's going to be possible to do the impact on the current workforce all in 5 to 6 months. So I mean, I don't think that I'm assuming that we're going to have a different group do this, because at the same time, we've got a number of tasks from the operations committee, which they have till December 2025. I don't think it's possible for the same group to do both. So I just think we have to really rethink timelines and workload and the ability to actually do a good job. I just don't see how you can do all of that in 6 months.
It's an interesting point too, that is the work of the transition. So we could conceive of our work as a board to develop the plan to get to a universal health plan, and then suggest to the legislature that a different group needs to take up the transition planning. So the main question is the work of transition planning the work of this board, or is it the work of a different body that we would just recommend to the legislature to pick up after we've completed our deliverable? It wasn't called out, well, it was called out in the legislation, you know, but it's not clear sort of, you know, they just said to come up with a plan for how you would do the transition. So yes,
I would just say this would be the biggest change in our state ever, affecting 4+ million, everybody in the state. That I've always felt that providing some sense of a transition and some confidence around that was really important to back up the plan. Because I felt that if we have a plan that says we're going to make all these incredible changes to everybody and everything, and then the next question someone's going to say is, well, how are we going to get from here to there? I just think doesn't provide the kind of credibility to the plan that's necessary.
so you think it should stay within the board and just extend the timeline?
I think it should stay within the board. I think it's going to take additional time. I think it's going to take additional resources. It's always been a concern of mine. If it's just my issue, I can kind of live with it. But I've always felt we've short shrifted this transition work, and that it's going to be vitally important.
As a new member and been watching from the outside, I totally agree from what I've heard, and it's a glorious plan. But if we can't, how do we transition from here to there? I'm afraid it just will be another plan that sits on a shelf and doesn't really engage people. It's possible. I was second versus concerned about this.
Okay, so we have a couple other agenda items
Michelle.
to get to. Michelle, do you want to chime in quickly and then we'll?
I guess I've always thought that this work has happened in phases, and we are the next phase of the work of the task force, and that we would have a role in recommending the next phase of this work. But I think we could lay it out as either this is the next phase, or we are already rolling and we could get an extension to continue the work. But I think either way, we're going to have to, that's going to be a decision the legislature is going to have to make one way or the other.
Okay,
I would just add, I mean, if we're gonna have it be another phase, then let's just not do any of this. I mean, either we should do it well or say it's up to someone else in the future. But I think to start to try and do all of this sets us out for failure if we're going to say someone else needs to think about transitions.
yeah. Okay, so we're gonna, when we come back next board meeting, we're gonna be having a really thoughtful discussion about as we assess all of this, what is a realistic timeline? We really need to move on to other agenda items. Amy, is there something you need to chime in?
I want to just understand when the board will be communicated with the plan for the April board meeting so that we can make arrangements, you know, like childcare, work meetings. I have a journey doing something, so thank you.
Yeah, that's their next topic right now. So yeah. So talking about our April board meeting. So I just want to quickly review what's going on here with staff. So Jenny, our interim ED, has her last day tomorrow, and Mimi doesn't start till April 7th. So we're going to have about 3 weeks in there with no ED, except Katie being willing to step in for emergency decisions. Kim Yee Kim Yee is our current policy analyst. She's on rotation from OHA. Her rotation is supposed to end in March, but we'll have her hopefully now till June. Eventually, we're going to need to hire a new policy analyst. That will be Mimi's job once she's more settled. And Kim will be on leave for a little bit later this month into early April. Katie's staying until April 11th, and our board meeting is April 17th, April 17th. So we have a lot of staff transitions happening. Currently, the plan design committee is the only one where we will have a staff member available to help with the agenda and the minutes. The question is a couple of things. We've thought about perhaps in April putting a pause on committee meetings. So this would affect operations and finance, particularly community engagement optionally. So because of the transition in staff and sort of how this would be supported, we could consider not having our committees meet in April, just to give everybody a breather, kind of focus on onboarding Mimi and trying to put together a strategic planning discussion for the full board. The committees, of course, are welcome to meet. DCBS has assured us many times that they are very willing to step in and help support this board with temporary folks or getting people on board as quickly as possible. So it is possible for all of our committees to meet in April if we want to. The question is this a time where the committees might want to pause and just take a little bit of a breather, really think through the tasks and deliverables and the timeline that'll be required, and come prepared at our next board meeting to discuss that. If there's momentum going on in the committee meetings, I don't want to interrupt that. But with all the staff transitions, the April meeting structure is going to be difficult. It's going to be a little fragile, let's say. And so I wanted to put that before the board. So first of all, to decide if our committees would go ahead and meet in April, and we would just do our best with sort of staff limitations, or if you want to cancel your April meetings, reconvene the committees in May, once we have a little bit more grounding with staff. Yes.
So speaking for operations, we are not going to meet in March. We need to, operations committee members are listening, we're going to get an announcement out to you. But to me, I think if we were to also pause April, that would really set us back.
Okay. So operations not in March, but you would need it for April. Okay. Okay. Yeah, so Debbie, do you have thoughts on? So Katie will be here for the plan design meeting in
April 3rd.
April.
I feel okay about running the computer, and I feel okay about doing all the things I normally do. I don't feel okay about like being the staff, like,
agenda.
let's ask staff about this. Oh, staff, what do you think about this? I don't want to have to do that.
You also don't have to decide right now if you want to.
My recommendation would be to cancel April for plan design.
We do need staff to review a presentation by staff, so we would not really have anybody to
Yeah.
help facilitate that. So if we met, we could potentially need to talk about the straw proposal adjustments. I don't know that would warrant.
Yeah. Recommend canceling it right until May. And then finance.
Just talking with Kim really quick. I think we'll have to cancel the meeting on the 1st because that's already tentative, because I won't have any support. And the 15th, the question is whether we have that administrative costs panel engaged or not. And I need to actually check with Jenny because I don't know if they're able to attend it.
Yeah, and because you're having outside folks come in, we could make an effort to get
Yeah.
that staff. Like I said, we have access to temporary staff. We could help make it happen, but we just kind of want to know.
If anything, that would be on the 15th, not the 1st. That's what it's sounding like.
Okay.
Also the OHA.
My OHA staff is going to be gone. So.
And I guess my question would be, Cheryl, as a member of that committee, but wondering about even some more, just really talking with the new consultants and Echo Northwest, and no one ever, that would be possible for that meeting to just kind of get ourselves grounded on kind of what the contract says, what they think they're going to do.
Yeah,
I don't know.
my understanding is there's an onboarding meeting at some point. I don't remember if that was identified, but
It'll be the week of April 7th, but
Okay.
that one won't be for the whole committee. That'll
Right,
be
right.
for like the core team.
And any
So we
meeting of the
have
whole
to-
committee will need to be a public meeting, so that requires just a level of planning and staffing and agenda and minutes that, you know. Yeah. So all of this, so we're for sure canceling, I hang on a second, Amy. We're for sure canceling the April 1st for finance and then the 15th. What about communications in terms of continuing your
Yeah,
meetings?
I think we will cancel April. Also,
Okay.
Michelle and I. For
Okay.
staffing issues and because of just, we were gonna bring Diana back, but now we're pushing that out to be ready for the plan, so it makes sense.
Right.
March 26th, just to clarify though, is still a go.
Yes, we have an agenda and we have speakers coming
Mhm.
for next week, so
Okay.
as long as staff can support next week.
Yes, 100%.
Okay, so for our April board meeting, Mimi will have been on the job for 2 weeks. Kim will be with us, and we may or may not have an executive assistant, but we will have some support from DCBS. Judy, Kim, and I can work with Mimi on the agenda for April and have a focused strategy discussion. But we could also consider scuttling the April board meeting and having that bigger strategy meeting in May instead, just to give us all a little bit more time and breathing room. Understand, I don't mean to spring all this on you, but these staff changes just occurred in the past 2 days. And so it's just been a lot to sort of consider what the implications are and what's realistic in terms of planning a big meeting like this. So We can go ahead with the April meeting. We can pull that off. Judy and Kim and I can support Mimi and we can make that happen. In terms of Amy's questions, I don't think we would change anything in terms of the logistics of the meeting. It would be the same time, same options for virtual or in person. But we would just be more focused on overall strategy. But we could also decide to cancel our April board meeting and then just have a more planned, thoughtful, bigger discussion about our overall strategy, our timeline, our work plan in May instead. I just wanted to get your thoughts on that.
And knowing all that goes into it and the bandwidth that you have, and also the expectation amendments to do to really be prepared for that meeting and whether that's going to be possible with all the other goals.
Yeah.
Of onboarding.
Yeah. Judy, what do you think?
Thank you. Regardless of whether our next strategy meeting is in April or May, it would be ideal if all board members are able to attend this one in person. Just on nature of one of the interactive activities that I'm hoping we can do is within the room. It's possible to do it hybrid, but it feels more inclusive if everyone is there, and we can pull content from you live.
So logistics wise, I wouldn't want to make too many changes if we were going to do it in April, but just that idea alone that we should all be in person, it might be easier for planning to postpone until May.
Yeah.
Is that okay?
Yes.
With everyone? Okay. So we will plan to cancel our April board meeting and have a big strategy meeting in May and come back with a lot of ideas and thoughts on that. I appreciate that. I really want to give a few minutes to Jenny to talk about the budget. That's been an issue for us. And I'm hoping, Jenny, that you can go through it in about 10 minutes. Do we have any?
We do have one person signed up to share a public
Okay. Do people mind going a little bit over today? We had a lot of sort of logistics to get through. Okay, we might go a few minutes over with our meeting today, but I want to give the chair to Jenny to talk about our budget.
Thanks, Ellen. So, as the board requests, budget, this includes all of the budgeted items. We've excluded items that are zeroed all the way through anticipated and nothing planned to be used in that area. Some highlights from the budget that we've talked about before. So you'll see on the first line is personal services. Those are staff services. So that's the staff budget. I want to note that out-of-state travel is not the board's out-of-state travel. That is out-of-state travel for staff members. If you look at the bottom where it says special payments, that is what actually covers board member travel. And you can see that there's a fair amount of funding there in anticipation of the board doing those types of traveling meetings. I will also point out the professional services budget, which is about halfway through the document. And that is the category where we also have a breakout document that I'll talk about next, where we cover contracting services for the board. Most of the other categories here are regular sort of internal state functions. I just want to ask if anybody has questions about any of the categories, any of the columns in the budget, any questions about the budget numbers.
It's expend profit.
It's like the third from the bottom.
IT expendable property.
Right above that. Anticipated property costs for internal, so for internal staff, things like desks, chairs, things like that, that are purchased within the board's budget for the staff that works within DCPS. I will note that under facilities, rent, and taxes, DCPS has not been charging the board rent during this period because of some internal reorganization that DCPS has had, but we do anticipate that they will be charging rent in the next biennium.
So I want to point out too, that this is the money that this is not like money in the account for us, right? This is money that we've been approved to spend up to. It's a not to exceed amount. And the first column is our working biennial budget. The second is our actual spending to date, and then the third includes our actual and planned. And so if you look at the very bottom, the column next to actual and planned is whether we're over or under. Currently for the biennium, we're about $270,000 under what's been allocated to our work. So there's been a lot of discussion about, do we have enough money to do the work that we're doing? It's actually fairly difficult within a state agency to spend money. We're working to try and sort of front load some of our consultant services to try and use as much of our allocated money as we can in this biennium. But when we're thinking about next biennium and the resources that we need, there are a lot of reasons why we're not there. But currently we're about $270,000 under our expected spending for the biennium. And then the final column is what's been in the governor's budget for projected spending for the next biennium. You can see it's an increase over the current biennium, and it includes all of the consultants that we've already hired. And it's about $400,000 higher than what we've used for this biennium. So there's actually a fair bit of flexibility and money in there for us to reallocate if we need to. Do you want to say anything more about that?
Within this biennium, yeah, there's a lot of room for the board to try to aggressively bring on your contractors and spend as much money as possible, because you have that limitation both in professional services and this overage here that could also be allocated to that work during this biennium.
Question about the 25-27, the personal services first line. As I'm reading it, the first column being 674, 564 for the kind of the current stipend level. It's up to 994 for the next biennium. Why adding, is there more staff anticipated in there, or do you all get big raises? What happened?
Thank you for the question, Mary Lou. So no, it does not add additional staff. It is consideration for public employees. Every year they go up, they get another step increase. It's allocation for step increases and inflation.
Okay,
Well,
just really
$400,000?
That's a lot. Just feels to me.
Yeah.
I can have our budget person review it and make sure, we went over this extensively, so
But it's
I'm
no
sure
new
that it's correct,
positions.
but it's no new position.
And then my other question is the OHA people that have accessible to you. That's not, is that included in this?
That
number,
is not
or
in our budget.
They've got
No.
their own.
That's
They cover
within
that.
the OHA budget.
Thank you.
Any other questions? Okay, and then if you could briefly go over the professional services budget to
So for
show.
professional services, this is where what Tom mentioned in terms of limitation really comes into play most directly for the board. In that the limitation for this biennium was $500,000 for professional services. The limitation in the 25-27 biennium is $534,000. And so right now, the board has expended $7,760 of its professional services budget. With the onboarding of Echo Northwest and the onboarding of Milliman, it is definitely possible to expend a great deal of money before the end of the biennium. One thing to note in terms of how much money the board actually does have this biennium, in addition to the $500,000, like Helen mentioned, the overage in the budget. But there was an anticipated cost of $120,000 for the interagency agreement between the board and DCBS and OHA to bring on our HMA consultants. That was to cover some work that OHA was responsible for, but they hadn't hired the people into the positions for yet. And so OHA is actually absorbing that $120,000 contract. So the board actually has an additional $120,000 to use in this biennium as
So
well.
620.
620.
500,000.
Oh, no, it's not in addition to the 500,000.
Okay.
It's just not,
Oh,
it
I
wouldn't
see.
be part of that second column contracts in place.
Okay.
That could be reduced by 120,000.
So it's more flexibility within the 500,
Yes.
not in addition to that.
Not in addition.
And the idea of knowing governmental budgeting, July 1st, everything.
Everything goes
disappears,
back to
and so-
534,000.
So if we need to
Yes.
get as much as we can contracted.
And based
before.
on prior conversations. Or we've added underneath the considered unbudgeted needs that the board has discussed before, and that would be $200,000 for community engagement, general engagement, and $100,000 for contingency fund, given that the board's work is so iterative, as everyone's been talking about through the process for strategic planning.
Amy?
I'm wondering if that community engagement line should be community engagement and communications, since we don't know quite yet, maybe, which expertise will be needing for what in that time frame.
So the 50,000 communication support, is that what you mean?
200,000.
Oh, the
At
200,000, yeah.
at the very bottom, adding
Unbudgeted.
communications to that.
Bruce, did you have something?
Yeah, I would just say, depending on our discussion about transition, I don't think that there is sufficient resources within that line to do an assessment of the community's readiness and come up with a transition plan.
Okay, I want you to throw out a number for, this is, would also go under unbudgeted need for
Yeah.
25-27, throw out a transition number.
150,000, 200,000.
200,000.
If you're gonna actually do that, I would also defer to others, but based on our discussion about long-term care, I don't know whether we're gonna need additional resources. I don't see that anywhere.
Yeah, yep. Okay. We'll pull that in. Okay, again, this budget, and I think kind of thinking through what we're spending and what we need is going to be also part of our strategic planning. Of course, we're in the legislative session right now. So this is the budget that the governor has recommended without the unbudgeted need in 25-27. So Jen, you want to say anything about that process, or?
Sure. So as you all know, I think the board's budget is within the DCBS budget. In terms to make a request for any additional funding during this legislative session, a request from the board would have to go through DCBS and the governor's approval, and also the DAS fiscal office would have to approve that as well. So in order for the board to make a request from the board for additional funding, that would need to be within the structures of DCBS with multiple approval levels for additional changes to the budget as it is.
But possible movement, I mean, if we looked at the various lines and saw that there was something like, I still am interested in that. I understand steps, I want everybody to get all their steps, but we're hiring new people, we're doing whatever. The 994, I'm just wondering if there's any flexibility in that personnel line. And could, without approval of all kinds of layers, can those lines move? Do you have that capability to move things if you need more down in the unbudgeted communications, whatever?
That's a great question, Mary Lou. And so, like Helen mentioned before, with the bottom line, the last column within the 25, or I'm sorry, 23, 25, you have an overage there, and that is budgeted according to the board's needs. So if in that circumstance, you get into it to 25, 27, and you're still seeing a big black number,
Yes.
you would definitely be able to move things around. As our budget office continues to sort of reiterate to all of us, as long as that number stays black,
yeah,
the board has some discretion over how that funding is used.
Okay, thank you, Jenny. I appreciate that. I wanted to make sure to do that because last time we'll have you able to do that. We should move to public comment. I'll just say in terms of next steps, all the board members can anticipate getting an email from us in the interim, reminding you about some homework and some tasks to think about before our next strategic planning meeting, and with a clear notification about the meetings that are still occurring in the coming weeks and the meetings that are canceled. So we will communicate that to you very shortly And then encourage you to do a little homework in between before we reconvene in May. And then we can move to public comment. We have, you said 2 people?
One person,
Oh,
yeah.
1 person for public comment.
Yes, Lou Sinek. Oh, I'm sorry. Hold on one moment, Lou.
I'm sorry, I just.
Oh, yes.
Helen, would you like us to send out the federal health policy update just so we can?
Oh, right. So I skipped over so I'll let the board know that we have had conversations with the governor's office and requested that they help us with federal health policy updates. And they've been really generous and helpful in that regard and sent us a whole bunch of talking points, which we don't have time to go through today. So we can send that first policy update to you in an update email and you can read through it, but it will be a standing agenda item on our agendas from now on that will do quick policy updates from the federal level as part of this meeting too. But this first one will just go out in an email. Thank you, Jenny, for calling that.
All right, Lou, you have 2 minutes and you can take it away when you're ready.
Okay, can you hear me?
Yes.
Okay, good. I can never see myself on the screen. I don't know why. Anyway, I just wanted to compliment the board. You're doing a great job. And remember, you're inventing the first universal plan in America. I mean, you're doing great. And I'm really glad that you're going to increase the necessary funding because, you know, an example is a public corporation, which has to be kind of invented. You're going to have to hire an attorney that's really savvy about public corporations. You're going to need actual organizations as you get the program together, and other corporations. September 2026, that's a year and a half from now. I had a comment on community engagement subcommittee. I want to remind the committee that there are 270,000 union members in this state. Plus, some of them have their own trust funds, you know, multi-employer plans like UFCW, building trades, Teamsters. So I think they should be on your list to engage with, because if they understand the plan and you make the adjustments necessary, that's 270,000 votes. And I just want to remind the board that our current system has been or is almost totally bought out by nationwide investment companies. This is a challenge. They are wrecking our healthcare system as fast as possible because healthcare is for sale instead of service. So that's my comments. I'm right behind you folks all the way. And I don't want to get carried away. Thank you for listening to me.
Thank you, Lou. Appreciate you.
Oh, yes. And then if we have Danielle Ross, who did the adjournment quote, she's going to come on and talk about it.
Can you guys hear me okay?
Yes.
Okay, I volunteered to share a quote, and so I picked one. It's not what I pictured in my life at this point, but it's a job and a start. You have to keep faith. I chose this because it's a quote from one of our neighbors, not like a famous or historical person, but a 55-year-old gentleman who was homeless at the time. And despite everything that he had been going through, he managed to keep faith and stay positive about the positive developments in his life. And I just think it was a good demonstration of perseverance.
Thank you, Danielle.
Thank you. Any other comments for the good of the order?
Just
Yes,
a
go
very
ahead,
quick comment. This time I just finished teaching the health system finance, a graduate class. And one assignment I assigned them to do is for them to watch or participate at least one board meeting or committee meeting. And they had to write a reflection. And I just finished grading 17 of those papers. And each of them, they praised how the board are working towards the development of university. About the board. And there's so many praises about the board. And this also having every one of them say this is a wonderful learning experience, that how the board is doing is exactly tied with what we discussed in class.
That's great.
Maybe we get some interns from you.
I wonder if you'd be willing to share one of those reflections for our next adjournment.
Because everything I share will be public document. I want to ask the
Yes.
permission from students.
Yes, that'd be
I will
great.
ask
We'd
them.
love to hear the reflections. Yeah. Okay.
And I just like quickly to say thank you for welcoming me in. And all of you that I've been talking with on the phone, kind of getting updated. And so, as I said to Helen, it feels a little like coming in the middle of a movie. And now the main actors, we're changing those too. So very interesting, but I really appreciate the acceptance and feel like I'm part of it now. So
Great.
thank you very much.
So glad to have you. Great. Okay. And Michelle, did you want to say something?
Well, definitely thank you, Mary Lou, for signing up for this, even after watching us in progress. Appreciate that, and glad to have you on board. I wanted to acknowledge and thank staff. I'm really sad. I'm happy for staff. It's a loss for us, and we wouldn't be here without you, especially as volunteer board members. Thanks for getting us this far, setting us up for success. Excited about the new folks coming on board, but Jenny, Katie, you'll be missed. Thanks.
Thanks, Michelle. Yes, I think you echo the sentiments of all of us on the board. Thank you from all of us. Okay, and with that, we're
Yes,
adjourned.
thank you.